The storm had been chewing on Galveston since sunset. Wind shoved rain sideways across the parking lot lights, and the glass front of St. Bridget Harbor Medical Center trembled in its frame. Inside the emergency department smelled of bleach-wet asphalt and burnt coffee. Nora Lane stood at the sink, scrubbing until her knuckles flushed pink. The water ran hot, then suddenly cold. She rinsed, dried, and tucked a strand of hair under her cap. Her badge read Nora Lane RN. It looked ordinary. She did too if you didn't watch long enough. Across the bay of curtained rooms, Dr. Julian Kerr leaned over a charting station, eyes fixed on a screen that kept feeding him new names. Thunder shook the ceiling tiles. He didn't flinch. The radio crackled. A paramedic's voice broke through the static. Critical inbound, 1 male, no pulse. The words didn't stop traffic. They redirected it. A tech kicked a stool aside. The charge nurse pointed down the hall. Trauma 1. The automatic doors slammed open. Cold air rushed in with rain spray, and for a moment the ER smelled like the ocean. The gurney came in fast wheels, skidding on tile. A man lay on it in shredded camis, chest soaked dark. His face was pale in the harsh lights, lips tinged blue. Dog tags tapped the rail with each jolt. One paramedic compressed hard, counting under his breath. Another pumped a bag valve mask, pushing air that didn't seem to go anywhere. Name, Kerr asked, already moving. Captain Mason Briggs, USMC, the paramedic said. Multiple gunshots, lost pulse en route. Oscitas, no shockable rhythm. Pads hit skin. The monitor drew a flat line that looked almost tidy. Compress, Kerr said. Epi, now. Hands shifted. Someone pushed a syringe. Someone called time. The room narrowed to the rhythm of palms on sternum and the wet squeak of gloves. Outside the storm hammered the windows, a second drum behind the code. Nora was not at the bedside. She stood near the foot of the gurney, just beyond the crush of bodies, watching the rise and fall that wasn't happening. Her eyes moved over Briggs the way a diver reads the surface of a dark current. Neck veins, chest shape, the angle of ribs under soaked fabric, the mask meeting resistance, then giving back nothing. Kerr glanced at her once. Lane, get me another line. Nora didn't move. Kerr saw her stillness and mistook it for hesitation. Most nurses in that room moved like sparks. Nora held her ground like a post driven into sand. Her shoulders stayed level. Her breathing stayed slow. The bag valve mask kept fighting back. Each squeeze met the same stubborn resistance, like pushing air into a sealed bottle. The paramedic's jaw tightened. I can't get chest restrictions, he said. Nora's gaze dropped to Briggs's collarbone. A wet sheen clung to his skin. His trachea looked just a little off-center, a small betrayal. She inhaled and caught more than disinfectant. Under it, a ghost of diesel and cordite that didn't belong in Texas. It slid through her mind and vanished, leaving only the sound of the monitor, silent but loud in her head. She flexed her fingers once. In her pocket, the coin shifted against her ribs, a soft click no one else heard. Outside the bay, wind howled through the ambulance bay, like undertow pulling at a swimmer's ankles in the dark. 2 minutes, no pulse, a resident said. Keep going, Kerr replied. His voice stayed sharp, not cruel. 3 minutes, the resident said. Kerr stared at the monitor as if he could persuade it. He looked at Briggs's slack jaw, the blood seeping from beneath the field dressing, then at the clock. Okay, we're done. Not yet, Nora said. It wasn't loud, it was certain. Kerr's head snapped toward her. What did you say? Nora stepped in. She didn't ask for space. She took it. His chest isn't rising. You're ventilating against a lock. A lock, the resident echoed. Kerr's jaw tightened. Lane, stand down. We are running a code. Nora pressed 2 fingers along Briggs's ribline, searching. Her hand paused. She listened with her palm. Thunder rolled again, and in that tremor, she seemed to find what she needed. Needle, she said. 14 gauge. Kerr took a step in front of her. You are not credentialed to do that? Nora looked up at him, calm eyes, something older underneath. You want to call it do it after he can breathe? The monitor stayed flat. The bag valve mask squealed again. Kerr held her gaze for 1 beat, then shifted aside. 1 attempt, he said. Then we stop. Nora nodded once. No relief, just motion. She swabbed fast fingers, sure despite blood and rainwater. The needle went in with a firm push. For half a second, nothing. Then air hissed out long and ugly like a lung, finally finding a door. The bag valve mask moved easier in the paramedic's hands. The monitor flickered. A blip. Another. Hold compressions, Kerr said, voice lifting despite himself. The room froze around the line as it crawled back into life. A weak rhythm appeared, hesitant, then steadier. Not safe, but real. Someone exhaled hard. Kerr stared at the catheter in Nora's hand. How did you know? Nora taped it down. Because he was dying of pressure, not blood. The team snapped back into motion. Fluids ran. A nurse called for O negative. The resident barked out numbers as they appeared. Briggs's skin stayed gray, but a hint of color crept toward his lips. Kerr leaned close to Nora. "Where did you learn that?" Nora kept her eyes on Briggs. Somewhere the rules were different. "That's not an answer." "It's the one you get," she said. Kerr looked like he wanted to argue, but the monitor beeped again, louder this time, and his focus returned to the patient. He lifted the sheet, checked the dressing. Blood seeped through, slow but persistent. "Or," the resident asked. "ICU first," Kerr said. "Stabilize, then surgery." Nora found Briggs's wrist and counted quietly. Her thumb didn't shake. In the pocket of her scrub top, the edge of a small coin pressed against her ribs, cool metal worn smooth by years of turning. A security guard pushed the doors wider as the gurney rolled out. The hallway lights flickered when lightning hit close. For a split second, the corridor looked like a ship's passageway in rough water. At the elevator, Briggs's head lolled to the side. His eyes fluttered unfocused. His lips moved. No sound came out, but Nora leaned in anyway. Kerr noticed. "Did he say something?" Nora straightened. "No." The elevator arrived with a hollow ding. The doors opened to dimmer light. ICU nurses waited, faces set, hands ready. Nora guided the gurney in one palm on the rail as if she could keep the man anchored by touch alone. When the doors slid shut, the ER noise cut off. There was only the hum of the elevator and the storm murmuring through the building's bones. Nora stared at the glowing floor numbers as they climbed and kept her hand steady on the rail. The elevator rose with a soft sway, like the building was floating. Nora kept her palm on the gurney rail as the floor numbers climbed. The doors opened onto the intensive care unit where the air felt colder and the light dimmer, a controlled dusk meant to keep bodies calm while machines did their work. A nurse in navy scrubs met them at the threshold. Her name tag read, "Mandy." Her eyes went straight to the monitor, then to Briggs's face. "Who's got reports?" she asked. Kerr spoke first, quick and precise. "Captain Mason Briggs. Multiple gunshot wounds. Arrest in the field. No shockable rhythm. Return of circulation after decompression and meds. He needs full monitoring and a surgical consult as soon as he can tolerate transport." Mandy's gaze flicked to Nora. Decompression. Nora stepped in, not defensive, just factual. Right chest. Tension. He wasn't ventilating. Mandy exhaled through her nose, a sound that carried both respect and alarm. "Bed 5. Get him on the vent. Labs now. Blood gases. Type and cross." Hands took over. Tubes were threaded. Lines were secured. A ventilator came alive with a steady hush. The monitor beeped in a regular pattern, like someone tapping a finger against a tabletop to prove they were still there. Nora watched the waveform settle. She adjusted the catheter dressing with 2 careful strips of tape. The skin around the site was slick with sweat and rainwater, and she dried it gently before pressing the tape down. Briggs's chest rose now, subtle, but present. The blue at his lips eased toward gray. Kerr leaned in to check the wound dressings. Blood still seeped through, slow and stubborn. It had the patience of the tide. "Pressure?" he asked. Mandy read the numbers. Low, but holding. We can support. He needs imaging. "Keep him warm," Kerr said. He glanced at Nora again, and the look stayed on her longer than it needed to. "I'll call surgery." Mandy nodded and turned away. Nora stepped back to give them room, but she did not leave the bedside. She kept her eyes on the monitor on the rhythm. Beep, beep, beep. Each sound landed like a stone. Priya Desai arrived a moment later, hair escaping her cap, cheeks flushed from running. She stopped short when she saw Briggs on the vent. "He's alive," she said, like she had to say it out loud to believe it. Kerr glanced at her. "For now." Priya's gaze slid to Nora's hands. "You placed that decompression needle," she said. Nora did not deny it. She simply looked at the dressing again, as if checking her own work for mistakes no one else would notice. Priya lowered her voice. That was fast. Nora met her eyes. Fast is the point. Kerr stepped away from the bed and motioned toward the glass wall of the unit where the hallway ran quiet and clean. "Lane," he said. Nora followed him out. Not hurried, but she did not drag her feet either. The door shut behind them with a soft click that sounded too gentle for the kind of night they were having. Kerr stopped near a window. Beyond the glass, the storm churned over the dark bay streetlights smeared by rain. The hospital sat at the edge of the water like it was bracing itself. He kept his voice low. "You realize what you did back there?" Nora's expression stayed neutral. "I kept him breathing." "You performed an invasive procedure without my order." "You were calling time," she replied. Her tone held no heat. It was only a line drawn in sand. Kerr studied her face as if he expected it to crack. It did not. That was not guesswork, he said. That was training. Nora looked past him to the window. Thunder rolled in the distance, a long, dull growl. "You have a history," Kerr asked. "I have a job," she said. "Here. I pulled your file once," he said. "Basic credentials, clean references, no red flags. You move like someone who has done this in places where there is no backup." Nora's jaw tightened for a fraction of a second, then relaxed. People move differently when they have to. Kerr stepped closer still, keeping his voice steady. Where did you learn to look for a tracheal shift in a room full of panic? Nora did not blink. Same place you learned to see a bleed without opening someone up. Watching enough bodies teach you. That is not an answer. Nora finally turned to face him fully. It's the only one I'm offering. Kerr held her gaze. He was not a man who liked loose ends. His eyes caught on her wrist as she adjusted her glove. The fabric slid back a little, exposing skin that should have been smooth and wasn't. A faint line, a pale scar in the shape of a thin loop like cord had once dug into it. Just below that, a smudge of ink, old and worn, barely visible. Nora noticed his eyes. She tugged her sleeve down. Kerr's mouth tightened. You should go home, he said, and there was something in his voice that sounded almost like concern. You were not scheduled for this trauma. You took it anyway. Nora's gaze drifted back toward the ICU door. If I go home, someone else will be at that bedside if he crashes again. You are not responsible for every heartbeat in this building. Nora's eyes flicked to him sharp. Tonight I am. Before Kerr could respond, the overhead speaker in the unit crackled. Incoming to the emergency department, 2 minutes. Second patient from the same scene. Kerr's shoulders shifted, the weight settling back into place. We need to go. Nora started moving before he finished speaking. They rode the elevator down in silence. The hum of the cables sounded like distant rotors. Nora focused on the numbers as they fell. She could feel the coin in her pocket pressing against her ribs with each breath. The doors opened to the ER, and the noise hit them like heat. A stretcher was already rolling in, flanked by paramedics soaked through. Water pooled on the floor in their wake. The patient was younger than Briggs, face drawn tight with pain. A bandage wrapped his side. Blood spotted through in dark blooms. He coughed, and the sound was wet. Marine One paramedic said. Lance Corporal. Penetrating injury to the flank. Breathing shallow. Pressure dropping. Nora moved to the gurney and leaned in. Hey, she said soft enough to be for him only. Stay with me. The corporal's eyes fluttered open. They were glassy, unfocused. Then they caught on her face and held. A small muscle in his jaw moved like he was trying to swallow words that hurt. You, he whispered. Nora's chest tightened. She kept her expression calm. Yeah, she said. I'm right here. His eyes widened, and the fear in them was not the fear of pain. It was the fear of recognition. Wraith, he breathed. The words slid out like a confession. Kerr froze beside her. Priya, already at the foot of the bed, looked up sharply. Nora did not react the way a startled person would. She did not flinch. She did not stare. She simply placed 2 fingers on the corporal's wrist and counted. His pressure is falling, she said. Get fluids ready. Ultrasound. Priya's mouth opened as if to ask, then she caught herself and moved. The tech rolled the ultrasound cart in. The screen lit up gray and ghostly. Kerr leaned closer to Nora. His voice stayed low, but the edge was there. He called you something. He's hypoxic, Nora said. Delirium. The corporal's hand found her sleeve with surprising strength. His fingers clamped down like a drowning man grabbing rope. I heard your voice in the dark water, he said, words slurring. You said keep your mouth shut. You said swim. Nora's throat went tight. She kept her eyes on the ultrasound screen even though Priya was the one holding the probe. Sir Priya said to Kerr, there's fluid. Kerr's focus snapped back to the patient. Internal bleed, he said. We need to stabilize him. Nora eased the corporal's hand off her sleeve. She did it gently, like detaching a child from a parent's coat. You're safe, she told him, and her voice stayed even. You're in a hospital. His gaze searched her face as if he expected it to shift and reveal another person underneath. They said you went under, he murmured. Nora did not answer. She looked to Kerr. We need to control the bleed before we move him, she said. Kerr nodded, though his eyes stayed on her for a beat too long. Pressure infuser. 2 large bore lines. A security officer stepped into the trauma bay doorway, shoulders squared, scanning the room. Sergeant Lena Ortiz wore her badge on her belt and her suspicion on her face. She watched the corporal's hand reach for Nora again, then watched Nora pull away like the touch burned. Ortiz walked closer. We good in here? She asked. Kerr replied without looking up. We are handling it. Ortiz's gaze shifted to Nora. You were on break when this started, she said, not a question. Nora kept her hands moving, checking the line tightening tape, adjusting the monitor leads. Break is over, she said. Ortiz studied her for a moment, then turned away to the hall where more voices rose. More wheels, more rain. They stabilized the corporal enough to move him. Kerr called for imaging and the surgical team. Priya handed off vitals to the receiving nurse. The gurney rolled out, leaving behind the smell of blood and wet fabric. For a few seconds, the trauma bay emptied, and the quiet that followed felt wrong, like the air was holding its breath. Nora stood at the sink again, washing blood from her hands. The water ran pink, then clear. Her fingers were steady. The faucet rattled with the vibration of thunder. The coin in her pocket clicked softly when she shifted her weight. Priya approached, stopping at a respectful distance. That name, she said, cautious. Wraith, is that a nickname? Nora dried her hands and folded the paper towel in half, then in half again, precise. People say a lot of things when they're scared, she replied. Priya did not press, but her eyes lingered on Nora's sleeve. You did not look surprised, she said. Nora tossed the towel. I was busy. Priya nodded slowly as if filing that away. Okay, she said. Busy. Kerr stepped into the bay and closed the curtain behind him. His face was composed, but his eyes were lit with something that had not been there earlier. You want to explain that, he said quietly. Nora met his gaze without blinking. He's bleeding out, that's the only explanation that matters. Kerr held her stare. The storm rattled the vents. A monitor beeped in a neighboring room, steady and indifferent. You're not just an ER nurse, Kerr said. Nora's expression did not change. Tonight I am. Kerr's jaw flexed once. He looked like he wanted to say more, but a nurse called his name from the hall. Another patient needed him. The work kept coming, the way waves kept coming, no matter how many you survived. Kerr took a step back. His eyes stayed on Nora for one last moment. Stay where I can find you, he said. Nora gave a small nod, neither agreement nor defiance. She watched him go, then reached into her pocket, touched the edge of the coin, and let it sit there like a weight that kept her from drifting. Behind the glass doors leading to the ICU corridor, the lights were dim and steady. Somewhere up there, a machine counted out a rhythm for a man who had been dead on her table. Nora listened for it without moving her face, calm. Her shoulders squared, as if still bracing against the pull of the water. Nora stood with her back to the ICU doors, listening the way you listen for surf in the dark. The rhythm from upstairs was faint through glass and distance, but she could feel it anyway, a steady tap inside the building. The storm kept pressing its wet palm to the windows. Somewhere down the hall, a vending machine hummed like an idling engine. Her hands were clean now. The smell of blood still clung under her nails. A nurse hurried past, eyes fixed on a tablet. Another tech rolled a cart of linens. The ER moved on because it had to. The night did not care what anyone wanted. Nora reached into her pocket and touched the edge of the coin. Cold, smooth, familiar. She left it there and let her hand fall. The intercom crackled. ICU to emergency. Dr. Kerr, ICU bed 5, now. The voice was clipped, controlled, and pitched just high enough to mean the numbers were dropping. Nora was already moving when Kerr came out of a room with gloves in his hand. He saw her face and did not waste time asking. They ran. The elevator took too long. It always did when you needed it. Nora stared at the doors, like she could pull them open by will. Kerr's chest rose and fell faster than he wanted. He did not look at her. She did not look at him. Their focus was a single bed upstairs where a heartbeat had been rented, not owned. When the doors finally opened, the ICU smelled of antiseptic and warmed plastic. The light was dim, but the monitor glow made faces look sharper, more severe. Mandy was at the foot of the bed, hands moving fast. Priya stood near the ventilator, eyes wide, trying to keep her voice steady while calling out numbers. Pressure is crashing, Priya said. Heart rate is spiking, then dropping. He is losing it. Briggs lay pale under a thin blanket, his chest rising on the ventilator, his skin slick with sweat. His eyes were half open, unfocused, as if he was staring past the ceiling into weather. Kerr pushed in. What happened? Mandy's words came out in a rush. He stabilized, then his rhythm went irregular. He bradyed hard. We gave fluids. It is not holding. The monitor beeped unevenly, not a rhythm, so much as a stutter. It sounded wrong. It sounded like a radio trying to find a signal. Nora stepped to the bedside. She did not ask permission. She never did when the line started to fall. Her gaze moved over Briggs, the way it had in Trauma 1. She saw the chest, the catheter, the dressing, the tube lines. She saw the small swell of the ventilator wave, the way it did not match the effort the machine was making. She heard the tone of the alarm and did not let it climb into her throat. Kerr snapped on gloves. Get the crash cart. It is here, Mandy said. Her voice tightened. We might lose him. Nora placed 2 fingers on Briggs's neck. His pulse was thin and fast, then thin and slow, like it could not decide what to be. She leaned closer, not to speak, but to listen. The ventilator hissed. The monitor chirped. Under it all, she heard something else. A wet rattle deep in the chest. His airway, Priya said. Maybe a clot. Nora shook her head once. Small. Certain. Not the airway. Kerr looked at her. Then what is it? Nora did not answer right away. She took Briggs's wrist and lifted it slightly, watching the capillary refill. Too slow. She looked at his eyes, the pupils the half blink that did not track. The storm outside flared with lightning, and for a second the room flashed bright, too bright, like a flare in a sandstorm. Nora's jaw clenched. Mandy's voice trembled. His pressure is 40 over something. I cannot get a clean reading. Kerr moved to palpate the abdomen, then stopped when Briggs's monitor shrieked. The line dipped. The beep stretched into a long, flat sound that turned every head. Pulse lost, Priya said, and her voice cracked on the last word. Kerr's hands were already on Briggs's chest. Start compressions. Nora stepped in beside him and reached for the syringe on the cart. Her fingers did not search. They went straight to what she needed. Kerr saw it, the certainty, the absence of hesitation. Epi, he said. Nora's eyes stayed on Briggs's face. Not yet. Kerr's head snapped. Lane, do not. Nora lifted the syringe. He is not responding like a pure arrest. Something is locking him down. Compressions, Mandy called. Keep going. Kerr pressed harder, faster. The bed frame creaked. Nora watched the neck veins. She watched the chest tube sight. She watched the monitor for a flicker that did not come. A nurse on the other side fumbled with a bag of meds, hands slipping on plastic. Nora reached across Kerr's forearm quick and controlled and adjusted the angle of his hands. Higher, she said. You are compressing too low. Kerr's jaw tightened, but he shifted without thinking. The code had its own authority. Give the epi, Priya said, voice urgent. Nora did not. She leaned down near Briggs's ear and spoke low as if talking to him mattered even now. Stay in there, she said. Do not let go. No one else heard the softness in her tone. She straightened and moved to the head of the bed, her eyes fixed on the ventilator tubing. She followed it to the connection. She watched the chest rise. It rose, but the oxygen numbers fell anyway. His lung sounds, she said. Mandy blinked. What? Listen, Nora said. Priya grabbed a stethoscope and pressed it to Briggs's chest. Her brow furrowed. She shifted to the other side. Her face changed. Left is diminished, Priya said. Kerr looked up mid-compression. He already has a right decompression. Nora nodded, and now his left is failing. Mandy's eyes went wide. How? Nora did not explain. She did not need to. Trauma did not follow fairness. Kerr hesitated for half a second. It was the half second where protocol lived. Nora spoke into it. Do it, or he dies. Kerr's gaze held hers. The room was full of people, but for that instant it felt like only two existed. A physician trained to follow rules, a woman trained to break them when rules got people killed. Kerr's shoulders lowered, a decision settling into bone. Prep the left, he said. Now. Mandy moved. Priya moved. The cart was opened. The supplies were laid out. Nora did not wait for the full sterile ritual. She swabbed fast. She found the space between ribs with her fingertips. Her hand looked steady in the dim light. Too steady. Kerr was still compressing. Hold, he said. Stop compressions, Mandy called, and the room obeyed. Nora pushed the needle in. For a moment, there was nothing, just the hush of the ventilator and the rain against the window. Then air escaped sharp and harsh like something tearing free. Briggs's chest moved more easily. The ventilator pressure dropped. The monitor flickered. 1 beat. 2. A weak line crawled across the screen, as if it had to drag itself back into existence. Priya gasped, the sound caught between relief and shock. Kerr leaned close to the monitor. We have a rhythm. Mandy's hands flew to the blood pressure cuff. Pressure is coming back. Still low. Nora taped the catheter down with the same calm precision she had used before. She did not smile. She did not sag. She watched Briggs's face as the color returned by degrees. Kerr stepped back, chest heaving. Sweat shone on his forehead under the ICU lights. He stared at Nora as if he was seeing a structure beneath skin that he had missed. That is twice, he said, voice low. You brought him back twice. Nora finally looked at him. Her eyes were steady, but something flickered in them, not pride, not fear. Something like anger that had learned patience. I'm not doing this for you, she said. Kerr swallowed. Then tell me what you're doing it for. Nora's gaze went back to Briggs. For him. Briggs' eyelids fluttered. His lips parted. A sound came out rough and small like sandpaper. Nora leaned closer, ready to catch whatever slipped out. Briggs is on. Briggs's eyes opened just enough to find her. His stare sharpened for a second, then softened like a man waking into a dream he did not trust. You, he whispered. Nora held still. His throat worked, swallowing air. Wraith. The word was thin, but it landed in the room like a dropped instrument. Priya froze. Mandy's eyes cut toward Kerr. Kerr stared at Briggs, then at Nora, then back again, trying to assemble the shape of it. Nora's face did not change. She did not correct him. She did not deny it. She simply placed her fingertips on his wrist and pressed gently, grounding him. Rest, she said. The word was quiet. It was not a command. It was a promise she could not control. Briggs's eyes stayed on her, as if he was afraid she might vanish when he blinked. His gaze drifted, and his lids lowered. The monitors held. The ventilator continued its steady hush. Kerr exhaled slowly and stepped back from the bedside. He motioned for Mandy to continue the orders and pulled Nora toward the glass wall of the unit again. This time he did not start with protocol. He started with the name. He called you Wraith, Kerr said. Nora stared through the glass at the hallway, at staff moving like shadows. You said he was delirious, Kerr continued. Nora's voice stayed even. He is recovering from shock. People say strange things. Kerr's tone sharpened. He said it twice. Nora finally turned her head and looked at him fully. You want to make it a story? It is not. It is blood loss and oxygen. Kerr held her gaze and did not blink. I know the difference between delirium and recognition. Nora's sleeve had ridden up again while she taped the line. Kerr's eyes dropped to her wrist, the pale scar, the faint ink. He did not name it, but his face tightened as if he had seen a symbol he should not be seeing in a civilian hospital. Nora pulled the sleeve down without looking. Kerr lowered his voice. I'm going to ask you one more time. Who are you? Nora's jaw flexed. Her throat moved as she swallowed something that tasted like old water. I am the nurse on this floor, she said. Kerr looked away for a second, then back. Your hands do not match that answer. Nora leaned closer, close enough that only he could hear. Her voice was soft, and there was a warning threaded through it. Do your job, she said. Let me do mine. Kerr's eyes narrowed. My job includes knowing who's working in my unit. Nora's gaze did not waver. Then you are going to have a long night. Kerr stared at her for a beat, then stepped away. He walked to the charting station, opened a computer terminal, and logged in with a quick set of taps. Nora watched him from across the glass, her face still, her shoulders squared. Kerr's eyes moved across the screen. He clicked through Nora Lane's employee profile. Certifications, background checks, a clean list of workplaces with neat dates. Too neat, the kind of neat that felt manufactured. He scrolled, his brow furrowed. There was a gap, not a small one. Years missing, as if someone had taken a blade to the timeline and smoothed the edges. Kerr clicked again, tried another tab. The system asked for higher clearance. He leaned back the chair, squeaking softly on the polished floor. He rubbed his thumb across his index finger, a habit that looked like he was testing the feel of something invisible. Across the room, Nora turned toward the bed again. She did not look at the screen. She did not need to. She could feel the shift in him the way a current changes before it hits your legs. Priya approached Nora at the bedside, voice low. That name, she said. Is it real? Nora adjusted the ventilator tubing and checked the IV pump. Focus on his numbers, she replied. Priya swallowed, nodding, but her eyes stayed on Nora's face. You do not look like a person who gets called the wrong thing by accident. Nora's hands paused for a fraction of a second, then moved again. People hear what they want, she said. The monitors continued their steady beat. The storm outside eased for a moment, the rain thinning into a softer patter. The bay wind still pushed at the building, but less violently, as if catching its breath. Kerr stepped away from the computer and walked back toward the bed. His face was composed, but his eyes were different now. Sharper, more awake. Before he could speak, a different alarm sounded deeper than a bedside monitor. It echoed through the ICU doors and down the hall like a ship horn in fog. The hospital emergency alert system lit up on the wall display. Staff looked up in unison, faces tilting toward the speaker. Attention, the voice said, steady and official. Multiple incoming critical patients. Emergency department, prepare for surge. Nora did not move. She watched Briggs's chest rise and fall, listened to the monitor keep time, and kept her hands still at the bedside for one extra beat before she turned toward the door. Nora held the ICU door open with her shoulder and looked back at Mandy. Bed 5 stays warm, she said. If his pressure dips, call Kerr and call me. Mandy nodded fast. Where will you be? Downstairs, Nora answered. Kerr was already walking, pulling his gloves on as he moved. The deeper alarm kept echoing through the hall, that low horn that made the building feel like it was listing at sea. Nurses stepped out of rooms, faces turned toward the speakers. A unit clerk read from the screen and went pale. Surge incoming, the clerk said. Multiple critical, possible firearm injuries. The elevator doors opened and a gust of colder air slid out, carrying the smell of wet concrete. Nora and Kerr stepped inside. Priya squeezed in behind them, clutching a small notepad like it could anchor her. The elevator dropped. The numbers slid down. Nora felt the coin against her ribs with each soft sway, a steady little weight that kept time with her breathing. Kerr glanced at her in the reflective steel wall. You should not be leading this, he said quietly. Nora kept her eyes on the doors, then keep up. Priya's gaze moved between them, uncertain. She did not speak. The doors opened to the emergency department and noise swallowed them whole. Radios crackled, wheels shrieked, a man shouted for gauze. Another voice called out, blood pressure numbers that sounded like guesses. Cold air rushed in as the ambulance bay doors flew open again. Rain had soaked the paramedics and anyone unlucky enough to be near the entrance. Water pooled on the tile, streaked with mud and something darker. A stretcher came in hard, pushed by 2 firefighters. A young woman lay on it, with her eyes open too wide, staring at nothing. Her shirt was ripped along the shoulder. Blood slicked her collarbone. Guns at the ferry landing, a paramedic yelled. Crowd panic, trampling, shots fired. We have 6 en route, more behind. Ortiz stood near the entrance with 2 security guards, palms out, trying to keep frantic bystanders from forcing their way in. Her voice cut through the chaos like a command on a range. Back up, everyone back up. This is a trauma zone. Nora moved to the center of Trauma 1, as if the room belonged to her. She did not raise her voice. She did not need to. Her calm made a lane through panic. Tag and sort, she said. 1 triage nurse at the door, 1 runner for blood. Clear trauma, 2 for the next critical. The charge nurse blinked. Lane, are you taking lead? Nora looked at her once. Do you want the room lead, or do you want it loud? The charge nurse swallowed and nodded. Trauma 1 is yours. Kerr stepped beside Nora, tension in his shoulders, but he did not pull rank. He listened. His eyes tracked the flow of bodies, the open bays, the staff trying not to fracture. Priya, Nora said. You get ultrasound and stay with me. Priya's hands tightened on her notepad. Yes. Ortiz, Nora called, eyes still on the incoming stretcher. I need that hallway clear. No phones in here. No strangers. Anyone filming gets walked out. Ortiz's jaw set, already on it. The first patient was rolled in. Nora leaned in close enough that the woman could hear her even over the alarms. Hey, Nora said, look at me. The woman's eyes jerked toward Nora. There was fear there, raw and animal. Tell me your name. Jenna, she whispered. Jenna, stay with me, Nora said. Can you breathe? Jenna tried. Her chest rose shallow. A wet sound caught in her throat. Nora's gaze swept the wound. Entry near the shoulder, blood slick and bright, no exit. Nora pressed gently above the clavicle, feeling for swelling. Kerr, Nora said, voice flat. Possible subclavian bleed, pressure. Kerr moved in hand steady, IV access, 2 large bore. A tech rushed in with supplies. Priya rolled the ultrasound cart closer. The screen lit up and threw pale light on their faces. Nora's hands worked with speed that did not look rushed. She packed gauze into the wound, held pressure with a firm palm, and watched Jenna's eyes. Jenna's lashes trembled. You are doing good, Nora said, and her voice stayed even like she was talking someone through a rough wave. Another stretcher came in behind them, and another. The room filled with bodies and blood and rainwater. A middle-aged man with a torn scalp wound was shouting for his wife. A teenager lay still, eyes half open, a dark stain spreading under his ribs. A security guard limped in with a gunshot graze and shock in his face, saying the same sentence over and over. They were running. I told them to stop. Nora did not look away from Jenna, but she heard it all. Her mind filed the details like coordinates. Trauma 2, the charge nurse yelled, we need a doc! Kerr looked to Nora. Nora nodded. Go, I have this. Kerr hesitated, then moved toward the next bay. He was still a physician. His instinct was to take control. Tonight control had shifted without asking him. Priya hovered at Nora's shoulder. BP 80 systolic, she said. Nora nodded once. Keep pressure. Call blood. Priya's voice rose. Type and cross now, we need O negative in the room. Someone ran. A cooler appeared like magic. The air smelled of iron and antiseptic and wet wool. A paramedic pushed in a new stretcher. Female 24, he shouted. Trampled. Possible pneumothorax. Breath sounds absent on the left. Nora's head turned. Her eyes narrowed. She made space with a flick of her wrist. Put her in trauma 3, she said. Get a chest kit ready. The paramedic blinked. We are full. Nora looked at the room. 3 bays occupied. Curtains half closed. People stacked in the hall. Then we make room, Nora said, and her voice did not change. Ortiz stepped in face tight. We have family trying to push past security. They are screaming. Nora did not look up. Keep them out. Ortiz's eyes flicked to Nora's hands. The way they moved. The way Nora did not flinch when blood smeared her glove. Ortiz lowered her voice. You have done this before. Nora kept pressure on Jenna's wound. So have you. Ortiz watched her one more beat, then left barking orders down the hall. The teenager with the stain under his ribs started to cough. Each cough was wet and shallow. His eyes fluttered like he was fighting sleep. A monitor alarmed from the bay where Kerr was working. Another alarm answered it from farther down the hall. Priya's voice tightened. We cannot hold all of them. Nora glanced at Priya. For a moment, Priya saw something in Nora's eyes that did not belong in a civilian hospital. A distant focus, a calm that came from someplace harsher. Nora leaned closer to Jenna. Jenna, I need you to keep your eyes open, she said. Can you do that? Jenna swallowed, tears gathering. Am I dying? Nora held her gaze. Not right now. Jenna gripped Nora's wrist. Her fingers were cold and slick. Please. Nora did not promise anything. She placed her other hand over Jenna's, grounding it. Breathe with me, she said. In, out. Jenna tried. The sound was thin. Priya slipped the bloodline into place. Transfusion running, she said. Nora nodded. Good. A man in a soaked jacket shoved past the curtain, face frantic. Ortiz caught him by the arm and hauled him back out. He shouted the woman's name. His voice cracked. Ortiz held him at the threshold. "Sir, you cannot be in here." He fought her. "That is my sister. That is my sister." Ortiz's grip did not budge. "Then let us do our job." The man's eyes landed on Nora, on the blood, on Jenna's pale face. His shoulders sagged. He stopped fighting and just stood there, breathing hard rain dripping from his hair. Nora did not look up. She could feel his desperation like a heat behind her. She kept her focus on the wound in front of her. "Kerr." Priya called suddenly, voice sharp. "Trauma 1, stable enough for transport." Kerr appeared at the curtain, eyes scanning. "Lane, can you release this bay?" Nora pressed the last dressing into place and taped it down. Jenna's pressure had climbed, not safe but better. Her eyes were still open, still anchored. Nora nodded. "Move her," she said. "Now." As the gurney rolled out, Jenna's fingers slipped off Nora's wrist. Nora felt the sudden absence like a cool draft. Another stretcher slid into the empty bay before the sheets were even changed. A fisherman, older face weathered, came in with a wound low in his abdomen and a blood-soaked sweatshirt. He smelled of brine and diesel like a boat engine that refused to die. He groaned when they lifted his shirt. The wound was small. The bleeding was not. Nora's eyes narrowed. "Do not open him here," she said. Kerr stepped in, gloves already on. "He needs surgery." Nora pointed toward the ultrasound screen. "He needs control first. The bleed is deep. If you rush him, he dumps everything before you clamp." Kerr's jaw tightened. He stared at the screen, then at the patient, then at Nora. His instincts fought with his pride. Priya watched Kerr's face change. She could see the moment he decided. Kerr nodded once. "Clamp and stabilize." Nora's hands moved. She guided Priya's probe position with 2 fingers and a quiet word. Priya followed without thinking. The image sharpened. Dark fluid pooled where it should not. Nora reached for a clamp kit and began to work. Her movements were clean. There was no extra motion. No wasted breath. It was as if she had done it in dim light with loud guns nearby and bright hospital lights could not slow her down. Kerr watched her for a beat too long. "You did not learn that in residency," said. "Oh?" Nora did not look up. "Neither did you." Kerr's eyes dropped to her sleeve. It had ridden up again a fraction. The pale loop scar showed at her wrist. Just below it, the faint ink smudge, worn down by time but still there. Kerr's gaze sharpened, recognition flickering like lightning behind his eyes. Nora felt it. She slid her sleeve down with the back of her wrist and kept working. The fisherman's blood pressure rose by a narrow margin. Not stable, not safe, but a little less on the edge. "Now we can move," Nora said. Kerr nodded and called for transport. Priya exhaled a sound she had been holding. "How do you know where to put your hands?" she asked quietly. Nora finally looked at her. "I pay attention." Priya's eyes stayed on Nora's face. "That is not what I meant." Nora held the stare for a second, then looked away. "Keep the probe steady." Priya did. The ER kept filling, then thinning like waves. People came in soaked and screaming. Others rolled out silent and pale. The storm outside began to ease, rain thinning into a softer sheet, but the air still smelled of salt and panic. Hours blurred. The overhead lights stayed the same. The coffee cooled and was replaced with new cups no one drank. Nora moved from bay to bay, reading bodies, counting breaths, pressing gauze into wounds, tying off bleeding that wanted to keep going. Ortiz returned with a fresh bandage on her own forearm, eyes tired. "Media is outside," she said. "They want names." Kerr snorted. "They get none." Ortiz's gaze went to Nora. "They are asking about the nurse running the room." Nora did not react. She was washing her hands again, blood swirling down the drain. The water was warm now. Her fingers looked almost normal. Kerr stepped close, lowering his voice so only Nora could hear. "That name," he said. "Wraith." Nora dried her hands. "You keep saying it like it belongs to me." Kerr held her gaze. "Does it?" Nora's eyes stayed calm, but the muscles at her jaw tightened. "People say whatever helps them make sense of pain." Kerr leaned in a little, not threatening but intent. "A Marine captain said it. A corporal said it. That is not random." Nora put the paper towel in the bin. She turned away from the sink and walked toward the hallway leading to the ICU doors. Her steps were quiet, controlled. Kerr followed her, Lane. Nora stopped near the glass doors. The ICU corridor beyond looked dim and still compared to the ER. The contrast felt like stepping from surf to shore. Nora placed her palm against the glass for a brief moment, feeling the cold. The coin pressed against her ribs again when she breathed in. "I'm not doing this conversation here," she said. Kerr's voice softened, and that softness made it more dangerous. "Then where?" Nora did not answer. She pushed through the doors. Upstairs, the ICU was quiet, except for the machines. The beeps were steadier now, like the building had found a calmer rhythm. Mandy looked up from the desk as Nora approached. "He has been stable," Mandy said, then hesitated. "But he opened his eyes a few minutes ago." Nora's stomach tightened. She kept her face calm. "Is he awake?" Not fully, Mandy said. He tracked movement. He tried to speak. Nora nodded once and walked to bed 5. Briggs lay under the thin blanket, face-drawn skin, still pale, but no longer the waxy gray of death. The ventilator tube remained, but his eyelids were not completely closed. They fluttered, then opened. His eyes found Nora. For a moment, he did not look confused. He did not look drugged. He looked like a man seeing something he thought belonged to another life. Nora stood still at the bedside. Her hand hovered near the rail, not touching him yet. Briggs's gaze held hers steady and intent, as if he were trying to pull a memory into focus without letting it slip away. Briggs's eyes held Nora like he was afraid she might dissolve if he blinked. The ventilator breathed for him with a steady hush, but his gaze was awake sharp in a way that did not match the drugs running into his veins. Nora stood still at the bedside. One hand rested on the rail, fingers relaxed as if she were leaning on a dock post, watching a boat fight the current. His lips moved around the tube. The sound that came out was a rough scrape, more air than voice. Mandy leaned in from the other side, checking the monitor, checking the tubing, checking everything that could fail. Easy, Mandy said. Do not try to talk. Briggs's eyes did not leave Nora. His brow tightened with effort. He tried again, and the word that slipped out was broken but clear enough to land. Wraith. The room seemed to pause around it. The monitor kept beeping indifferent. A drip chamber caught the light and flashed once like a tiny signal. Nora did not react the way people reacted to being recognized. She did not smile. She did not flinch. She simply leaned closer, her face calm, her voice soft. Captain Briggs, she said. You are in the ICU. You have tubes in your throat. You need to rest. His throat worked. His hand moved under the blanket, a slow crawl toward the rail. Nora watched it and did not stop him. His fingers found the edge of the sheet and gripped. Mandy glanced at Nora, then back to the monitor. He is more awake than I like, she muttered. Nora's eyes stayed on Briggs. Can you hear me? She asked. He blinked once, slow. Good, Nora said. Then do not fight the machine. Let it do its job. Briggs's gaze sharpened again. His lips moved around the same shape as before. He tried to force sound through plastic and pain. Dark, he rasped. Water. Nora's chest tightened, but her face stayed smooth. She watched the pulse ox climb and fall by a single digit, watched the blood pressure, numbers wobble and hold. You are confused, Mandy said, leaning in closer. That is normal after a rest. Your brain is catching up. Briggs did not look at Mandy. His eyes stayed on Nora like she was the only fixed point in the room. Nora reached down and placed 2 fingers on his wrist. The contact was light, just enough to confirm he was warm, just enough to anchor him. His pulse thudded beneath her fingertips, not steady, but present. You need to save your strength, Nora said. His grip on the sheet tightened. His eyes flicked once toward Nora's chest pocket where her badge sat. Nora Lane RN. The letters looked too clean for the way his gaze searched her. He blinked again, then the muscles around his eyes softened, the focus slipping. Mandy adjusted a dial on the pump and nodded to herself. Sedation is wearing off, she said. I am going to bring it back up a touch. Nora did not argue. She watched Briggs's breathing become less agitated as the medication took hold. His eyelids drooped, but the last thing his eyes did was find Nora again. Wraith, he whispered, smaller, this time, like he was saying it to himself. Nora kept her fingers on his wrist until his grip loosened and the sheet relaxed. A quiet step sounded behind her. Kerr had come in without making a scene, as if he did not want the room to know he was listening. His eyes moved from Briggs to Nora, then to Mandy. He talked, Kerr said. Mandy nodded. Barely. He tried. Kerr's gaze stayed on Nora. He said a name. Nora released Briggs's wrist and straightened. He is coming out of sedation, she said. Words drift. Kerr took a step closer. He said it twice. Mandy busied herself with the charting station, not looking up. ICU nurses learned when to make themselves invisible. Kerr lowered his voice. Wraith. That is not a random sound. Nora's eyes remained on Briggs, as if she could keep his rhythm smooth by watching it. He is a Marine who arrested twice, she replied. His brain is replaying stress. Kerr waited. He did not fill the silence. He let it sit between them like a scalpel on a tray. Nora finally looked at him. Her expression was calm, but her eyes carried a warning. Do not do this here, she said. Kerr's jaw flexed once. Where then? Nora did not answer. She glanced at Mandy. Call me if he changes, she said. Mandy nodded quickly. I will. Kerr followed Nora out of the room and into the corridor. The ICU hallway was dim and quiet, the floor polished to a soft shine. Every few feet, a monitor beeped behind glass, a chorus of steady taps that sounded almost like rain when you stopped to listen. They walked to the end of the hall, where a small window looked out toward the bay. The storm had thinned, but the water beyond the parking lot lights still churned dark under low clouds. Kerr stopped and turned to her. You are not going to keep brushing this off, he said. Nora's shoulders stayed squared. You should be in the ER, she replied. I am where I need to be, Kerr said. You performed procedures outside your role. You made calls that kept people alive. Now, a Marine captain is calling you by a name that does not match your badge. Nora stared out the window for a beat. The glass was cool against the side of her knuckles when she rested her hand near it. She could smell the faint salt even through the building, as if the storm had soaked it into the walls. Kerr softened his voice, but the pressure stayed. If something follows you into my unit, I need to know what it is. Nora turned back to him. You think a nickname is something following me? I think you are carrying more than a nickname, Kerr said. I saw your wrist. I saw that mark. I have seen military tattoos before. Nora's sleeve covered it now. She did not tug it down. She did not touch it. She simply held Kerr's gaze until he stopped looking for cracks. I was in the service, she said. The words landed flat, not dramatic, not apologetic, just a fact. Kerr's eyes narrowed slightly. What branch? Nora hesitated just long enough to be noticed. Navy, she said. Kerr inhaled slowly. Medical. Nora's mouth tightened. Yes. Kerr waited for more. Nora did not offer it. He stepped closer still, careful to keep his voice low. Where did you serve? Overseas, Nora said. That is not a place, Kerr replied. Nora's eyes flicked toward the end of the corridor where a unit clerk was talking softly into a phone. No one was looking at them, but the building had ears. Hospitals always did. I do not talk about it, Nora said. Kerr's frustration showed not in volume, but in the set of his shoulders. Your file does not talk about it either, he said. I checked. Nora looked at him still. You pulled my file. I pulled the parts I am allowed to pull, Kerr said. Your timeline is neat. Too neat. And there is a gap. Nora's expression did not change, but something in her eyes hardened. You should not dig, she said. Kerr held his ground. You should not work trauma if you have a past you cannot keep out of the room. Nora's voice stayed quiet. I kept it out. Until people arrived bleeding. Kerr stared at her for a moment. The beeps behind glass kept counting time. Wraith Kerr said again, softer now. Is that a call sign? Nora did not answer. Kerr's gaze dropped to her chest pocket where her badge sat. He reached out as if he might touch it, then stopped himself. Nora Lane, he said. Is that even your name? Nora's eyes sharpened. That is the name on my license, she replied. That is the name you have for me. Kerr searched her face. You are asking me to trust you while you keep me blind. Nora looked away toward the window again. A wave of rain swept across the glass in a sudden gust. The parking lot lights blurred into white smears. You want honesty, Nora said. Here it is. I left. I did not leave clean. I came here because I wanted quiet. Kerr watched her profile. Quiet does not come looking for you in a trauma bay, he said. Nora's hand slipped into her pocket, fingers finding the edge of the coin. She did not pull it out. She only held it, the metal cool against her skin. I am not a threat, she said. Kerr's eyes stayed on her hand for a beat, as if he could sense the shape of the object in her pocket. You might not be, he said. But whatever made you does not feel finished. Nora's gaze snapped to him sharp. Do not talk like that, she said. The warning in her voice was real now, not gentle. Kerr's jaw tightened. Then give me something, he replied. Give me enough so I know what I am standing next to. Nora took a slow breath. Her face stayed calm, but her eyes flickered as if something in her mind had shifted its weight. I was attached to units that did not like paperwork, she said. Kerr's brow furrowed. Special operations. Nora did not confirm it. She did not deny it. She simply stood there and let the silence answer in the way silence sometimes did. Kerr exhaled and his voice dropped even lower. Does the hospital know? Nora's eyes met his. They know what they hired, she said. A nurse with a license and a pulse. Kerr shook his head slightly more to himself than to her. That is not enough, he said. Nora stepped closer, close enough that Kerr could see the fine fatigue at the corners of her eyes, the kind that did not come from a long shift. Her voice softened again, but the edge remained underneath it. If you make this official, she said, you turn it into a problem you cannot control. Kerr held her gaze. And if I do nothing? Nora looked past him down the corridor where an ICU door opened, and a nurse walked out with a cup of coffee that smelled burnt and stale. The nurse glanced their way, then looked away and kept walking. If you do nothing, Nora said, then you get to stay a doctor in a hospital. Kerr's eyes narrowed. He understood the subtext, even if he did not like it. Nora stepped back. I am going to check on Briggs again, she said. Kerr did not move out of her way right away. You cannot keep dodging, he said. Nora's face remained composed. I am not dodging, she replied. I am working. She walked toward bed 5. Kerr watched her go, then turned and headed toward the charting station at the end of the hall. He logged in again, fingers quick, jaw set. The monitor glow caught the hard line of his cheek. Nora paused outside Briggs's room and looked through the glass. Mandy was inside, charting moving calmly, Briggs lay still, sedated chest rising and falling with the ventilator. The beep remained steady, a measured tapping that was almost soothing if you did not know what it meant to lose it. Nora stepped into the room. Mandy glanced up. "He is resting," she said. Nora nodded. "Good." She checked the lines, adjusted the blanket, and watched Briggs's face. Without the effort of speech, he looked younger, less like a Marine, and more like a man who had been pulled too far out and dragged back. Mandy's voice softened. "He really said that name," she murmured. Wraith. Nora kept her hands on the IV pump, checking the rate. People say all kinds of things. Mandy did not press, but her eyes lingered on Nora in a way that said she had seen enough to know when someone was carrying a second life under their scrubs. Nora finished her checks and stepped back. She looked at Briggs one more time, then turned toward the door. As she passed the charting station, she saw Kerr at the computer's shoulders, tight gaze fixed on the screen. He clicked through tabs, tried different portals. His face changed as the system blocked him. A message popped up that he read twice as if reading it again might unlock it. He leaned back, lips pressed thin, then tried another search, this time in an external directory. His fingers paused, his jaw clenched. He stopped typing and stared at the blinking cursor like it was daring him. Nora did not speak. She kept walking. At the far end of the ICU corridor was a small staff restroom. Nora pushed the door open and stepped inside. The light was harsh, the air smelling of soap and paper towels. She braced both hands on the sink and stared at her reflection. Her eyes looked calm. They always did. The calm was not peace. It was control. She reached into her pocket and pulled out the coin. It was silver, worn smooth at the edges, scratched in places where it had been dropped or pressed too hard between fingers. She turned it once, then once again, feeling the ridges with her thumb. Faint sound came from her pocket, not the coin this time. Her pager vibrated a short pulse against her hip. Nora set the coin on the sink and pulled the pager out. The screen glowed a dull green. There was no code from the hospital, no room number, no medication request. Only 2 words, clean and unmistakable. "I see you." Nora stared at the message until the light dimmed. Her fingers tightened around the pager. The coin lay on the porcelain beside her, catching the fluorescent glare like a small, cold eye. Nora stared at the pager until the screen dimmed, then pressed the side button to wake it again. The words did not change. They sat there like a fingerprint on glass. "I see you." She closed her hand around the device. The plastic warmed against her palm. In the mirror, her face looked the same as it always did on shift. Eyes clear, mouth neutral. A calm expression that fooled people who did not know what it cost to keep it. She picked up the coin from the sink and slid it back into her pocket. The metal clicked softly against her badge clip. She listened for footsteps outside the restroom door and heard none. Only the muffled chorus of monitors, the distant squeak of a cartwheel, and the building's steady hum. Nora washed her hands again, slower this time, as if the routine could rinse off the message. She dried them, smoothed her sleeves down, and tucked the pager out of sight. When she opened the door, the hallway light seemed too bright for a place built to keep people calm. Kerr stood near the charting station, staring at a screen that refused to give him what he wanted. His posture was tight shoulders, slightly raised like he had been holding a breath for minutes. When he saw Nora, his eyes flicked to her face with the sharpness of a man trained to read a room. "You are gone," he said. "I used the restroom," Nora replied. Kerr's gaze dropped to her pocket, to the faint outline of the pager, then rose again. "You look like someone just told you the building is on fire." Nora kept walking. "Then you should stop watching my face and watch your patient." Kerr stepped in beside her, matching her pace. "Lane." Nora stopped and turned. "Nora," she corrected softly. Kerr held her eyes. "Something is wrong." Nora did not blink. "Lots of things are wrong. That is why you have a job." He waited for her to crack. She did not. The silence between them felt tight, stretched thin over an open space. A nurse passed carrying a tray of syringes. She glanced at them and looked away quickly, the way people did when they sensed tension they did not want. Nora started walking again. Kerr followed. Bed 5 sat behind glass dim light and quiet beeps. Mandy was inside charting. Briggs lay still, ventilator breathing for him, chest rising in a steady rhythm. He looked almost peaceful from a distance, like the storm outside had been sealed out by the glass. Nora pushed into the room. The smell hit her first. Antiseptic and warm plastic, the clean hospital scent layered over something faint and wrong, like wet pennies left in a pocket. Mandy looked up. "Vitals stable," she said. "Sedation holding." Nora nodded and moved to the IV pole. She checked the bags, the lines, the pump settings. Her eyes tracked the drip chamber, the meniscus of liquid catching the low light. It shimmered. Not like medicine in clear saline, like a thin film of oil on water. It shifted when the pump pulsed, almost beautiful, if you did not know what it meant. Nora leaned closer, careful not to touch the chamber with her bare skin. She kept her gloves on. She stared until the shimmer moved again, a faint rainbow at the edge. Mandy noticed her focus. "What is it?" she asked. Nora's voice stayed level. "When did you change his fluids?" "An hour ago," Mandy said. "Fresh bag, new tubing, all standard." Nora looked at the bag label. "Normal saline, lot number printed clean, nothing out of place." "Who hung it?" Nora asked. Mandy frowned. "I did." Nora did not accuse her. Mandy's hands were steady, her eyes were honest. Nora watched Mandy's fingers, the way she held her pen, the way she stood. No tremor, no guilt. Nora's gaze moved to the access port. A small cap, a small opening, a place where one clean thing could become another. "Do not touch the line," Nora said. Mandy blinked. "What?" "Do not touch it," Nora repeated, softer, sharper. Mandy's eyes widened. "Is it contaminated?" Nora did not answer. She placed her gloved fingers on the tubing below the port and followed it to Briggs's arm. She checked the insertion site. Skin pale, no swelling, no obvious infiltration. Then Briggs's monitor chirped, one sharp note. Another. The rhythm tightened. Mandy looked up, heart rate climbing. Ashatik. Briggs's chest rose, then hitched. His eyelids fluttered under sedation. A tremor rippled through his jaw, small at first like a chill. Nora's stomach tightened. She had seen tremors like that not in clean rooms, but under canvas, under red light, with sand in the air, and men shouting over engines. Briggs's hands twitched under the blanket. His fingers curled, then flexed again, fighting restraint he could not understand. Mandy moved to the charting station. "I am calling Kerr." Nora was already reaching for the pump. She stopped it with one firm press. The machine beeped in protest. The drip chamber stopped pulsing. Briggs's body jerked. The tremor climbed up his arms into his shoulders. His chest tightened against the ventilator's push. The monitor alarm rose into a continuous tone. "He is seizing," Mandy said, voice tight. Nora leaned in. "Call a code," she said. "Now!" Mandy hit the button. The unit's calm shattered. The overhead light above the bed seemed brighter, harsher. Footsteps pounded in the hall. Briggs's eyes opened. Not fully, but enough to show white. His pupils shifted too fast. The ventilator hissed harder, pushing air into a body that was suddenly resisting. Nora grabbed a syringe from the cart and drew up medication without looking at the label twice. Her hands moved like they knew the path. Mandy watched, stunned. "You have that dose memorized," Mandy said. Nora did not answer. She pushed the medication into the line, but not into the main port. She used a separate access, one she could trust. Kerr burst into the room, gloves half on Priya behind him. Priya's eyes locked on Briggs and went wide. "What happened?" Kerr demanded. Nora pointed with her chin toward the IV pole. "His fluids," she said. "Stop everything through that line. He is reacting." Kerr's gaze snapped to the pump, a drug reaction. Nora shook her head once. "Not like this." Briggs convulsed again harder. The bed rails rattled. The monitor numbers jumped like startled birds. Kerr moved to the airway. "Vent pressure is spiking. We are losing control." Nora grabbed a flush and disconnected the tubing at a safe point, clamping it off. She held the line away from Briggs's arm like it was poison. Priya's voice trembled. "What is in that?" Nora stared at the shimmer in the chamber. "Something that does not belong here." Kerr looked at Nora. His eyes were sharp, searching. "Do you know what it is?" Nora's jaw tightened. "I know what it does." She reached into the crash cart and pulled out a small case marked for emergency neuro events. She snapped it open and selected an ampule, then another. Her movements were quick, but not frantic. Kerr watched her hands. "Where did you learn that combination?" Nora did not look up. "Move," she said to Priya. "I need space." Priya stepped back, swallowing hard. Kerr stayed, but he shifted, giving Nora room at the line. Nora spoke to Mandy without turning. "Get a new bag, new tubing, full replacement, and call lab for talk screen stat." Mandy's fingers flew over the phone. On it. Kerr kept his eyes on Briggs. "Seizure protocol," he said, trying to pull the situation back into a familiar shape. Nora's voice cut through, quiet but firm. "This is not a routine seizure." Kerr looked at her. "Then tell me what it is." Nora flushed Briggs's line, with clean saline from a separate source, forcing the old fluid back out, dumping it into a waste basin. The liquid hit the plastic with a soft slap. The shimmer caught the light as it moved, thin rainbow sliding over the surface. Her throat went tight, not from fear, but from a cold anger she could not afford to show. "Someone put it there," Nora said. Kerr's face tightened. "In our ICU." Mandy returned with fresh supplies, hands shaking slightly now. "New bag," she said. Nora nodded. "Hang it. Do not use that port. Not the same port." Mandy obeyed instantly. Briggs convulsed again, but weaker this time. His muscles still fought, but the tremor began to fade, like a wave pulling back from shore. Priya stared at the waste basin. "That looks like oil." Nora did not answer. She checked Briggs's pupils, his skin, the tension in his jaw. She watched his chest as it began to accept the ventilator again. The monitor's alarm softened into an intermittent chirp, then into steady beeps. The heart rate slowed. The blood pressure climbed by small, stubborn increments. Kerr exhaled, but it was not relief. It was disbelief. He looked around the room, the clean walls, the staff, the closed door. How, he said, how does that happen? Nora's eyes stayed on Briggs. It happens because doors are not walls. Mandy swallowed. Security, she said. Should I call security? Nora nodded. Call Ortiz. Tell her no one touches his medications or lines without logging it. Tell her I want the med room checked. Mandy moved. Kerr stared at Nora, voice low. You are talking like this is an op. Nora finally looked at him. Her eyes were steady, but there was steel underneath a hardness she had been hiding behind calm. Someone tried to finish him, she said. Kerr's mouth opened, then closed. He glanced at Priya. Priya looked pale, hands clenched around her notepad like she might drop it. Kerr lowered his voice further. Why him? Nora looked back at Briggs. His eyelids fluttered. The seizure had drained him. His face looked drawn, like someone had pulled him through cold water and left him on a dock to breathe. Nora spoke softly, as if the room might be listening. Because he knows a name. Kerr's gaze sharpened. Wraith! Nora did not confirm it. She did not deny it. Her silence was the only sound between the beeps. Briggs's lips moved again around the ventilator tube. A rough sound scraped out, barely a whisper. Nora leaned in close enough to catch it. Kerr leaned closer too, listening. Briggs's eyes opened unfocused but intent. His gaze found Nora, then flicked to Kerr, then back. His voice was a thread. 2 words fell out. Broken, but clear. Not over. His eyes slid shut. His head sank into the pillow as if the effort had cost him everything left. Kerr stared at Nora. The words hung in the air, heavy and unfinished. Not over, he repeated, quieter. Nora stepped back and watched Briggs's monitor settle. She did not look surprised. She looked like someone watching the tide line for movement. Priya whispered, Is he saying he is not done fighting? Nora's eyes stayed on Briggs. He is saying someone else is not done. The room felt colder. The dim ICU light did not warm anything. The storm outside had eased, but the bay wind still pushed at the building. The glass door to the hall rattled once soft, like a reminder that the outside world was always there. Ortiz appeared at the doorway a few minutes later, rain jacket swapped for her security shirt. Hair damp at the edges. She scanned the room, taking in Briggs, the fresh tubing, the waste basin with the shimmering film. Talk to me, she said. Nora nodded toward the basin. His IV, she said. Something was added. Ortiz's jaw tightened. In ICU. Kerr stepped in. We need a chain of custody, he said. We need to know who accessed the med room. Ortiz's eyes cut to Kerr. You saying sabotage? Kerr hesitated, then looked at Nora. Nora's face gave him no comfort, only certainty. I am saying we cannot rule it out, Kerr replied. Ortiz's gaze went back to the basin. She leaned in, eyes narrowing. That is not normal medication residue. Nora's voice stayed even. No. Ortiz straightened and looked toward the hallway, toward the ICU entrance. Her hand moved to her belt radio. I want cameras pulled, she said. All access points. Elevators, med room, supply rooms. Kerr nodded. And notify administration. Ortiz's eyes hardened. Administration is going to make phone calls. Nora kept her eyes on Briggs. Let them. Ortiz studied Nora's face, then lowered her voice. If this is someone inside, we lock down. If it is someone outside, we lock down harder. Nora gave a small nod. Mandy returned with a clipboard and a trembling hand. Lab is running talks, she said. They want a sample from the waste basin. Nora held the basin steady while Mandy drew a sample into a sterile tube. The shimmer clung to the plastic like it wanted to stay. Priya watched, breathing shallow. How did you see it? She asked Nora. I did not notice anything. Nora capped the sample and handed it off. Because I was looking for it, she said. Kerr's eyes stayed on Nora as if he could see the thought behind her words. Why were you looking? He asked. Nora did not answer him. She checked Briggs's vitals again, adjusted the blanket, and made sure the new line was secure. Her fingers pressed lightly on the tape, smoothing it down as if the neatness could protect him. Ortiz stepped out to make her calls. Mandy returned to charting, trying to regain normal, but her shoulders remained tense. Priya lingered at the foot of the bed. Do you want me to stay? She asked, voice small. Nora looked at her. Go drink water, she said, then come back and be useful. Priya nodded and left quickly, relieved to have a task that did not involve naming the fear in the room. Kerr stayed. He stood near the glass arms loose at his sides, but his posture was tight. The physician in him wanted to categorize and control. The man in him was trying to understand how his hospital had turned into something else. He lowered his voice. That message you got, he said. Was it from the hospital? Nora's eyes did not leave Briggs. No. Kerr's throat moved as he swallowed. Someone is watching you. Nora's expression did not change. Yes. Kerr took a slow breath. And you still will not tell me who you are. Nora finally looked at him. Her calm had edges now, like glass. I am the person keeping him alive, she said. That is all you need in this room. Kerr held her gaze, then glanced toward the hallway, as if expecting to see someone standing there. The corridor was empty, but the emptiness did not feel safe. It felt staged. The monitor beeped steadily. Outside, a car door slammed somewhere in the lot. Footsteps echoed faintly beyond the unit doors. Someone spoke in a low voice near the elevator bay, too quiet to make out. Nora listened, head slightly tilted, not moving her eyes. Her fingers rested on the bed rail, ready. Kerr noticed the change in her focus. What he asked. Nora did not answer. She just kept listening. The footsteps stopped. The low voices faded. The building returned to its usual hum, but the air had shifted. It carried a new tension that did not belong to medicine. Nora looked at Briggs, at the steady rise of his chest, at the clean tape on the new line. She let her shoulders drop a fraction, not relief, only control. Mandy's phone rang at the desk. She answered, listened, and her face tightened. She glanced toward Kerr, then toward Nora, then back to the phone. Her voice dropped. Yes, she said. Yes, I understand. She hung up and walked toward them, steps careful. Lab confirmed something, she said. They cannot identify it yet, but it is not any standard ICU medication. They said it looks like an additive synthetic. Kerr's face drained of color. He looked at the waste basin, then at Briggs, then at Nora. Nora nodded once, as if hearing confirmation of what she already knew. Mandy swallowed. They also said someone called the lab before we did, she added, asking about tox screening on a Marine captain in our unit. The beep continued steady and calm, while the room grew quiet around it. Nora's hand tightened on the bed rail, just enough to whiten her knuckles beneath the glove. She released slow and controlled, and looked toward the glass door, as if she could see through it. Kerr spoke softly, almost to himself. Someone is ahead of us. Nora did not respond. She stood at Briggs's bedside, eyes steady, listening to the building breathe. Nora stood at Briggs's bedside, eyes fixed on the rise of his chest, listening to the building breathe. The beep stayed steady, almost polite, but the air in the room had thickened. It had the same feel as a shoreline right before the undertow catches your ankles. Kerr remained near the glass gaze, shifting between the door and Nora's hands. He had stopped trying to force medicine into neat categories. Now he watched for people. Mandy returned to the desk and kept typing, but her shoulders stayed high. Her eyes flicked up at every footstep outside the unit. The hall was quiet again, too quiet, like someone had pressed pause. Ortiz came back 10 minutes later with a folded printout and a face that had turned hard. Cameras, she said. Med room door opened twice during the last hour. Once by Mandy, once by someone using a badge that does not belong to this floor. Kerr's head snapped up. Who? Ortiz shook her head once. The badge ID pings as valid, but the name is blocked behind an administrative wall. Whoever it is, they are not staff. Nora did not move. Where is the footage? Ortiz's eyes narrowed at the way Nora asked it, not as a request, but as a certainty. Security server. I have a copy on my phone and another on a drive. No one touches it but me. Kerr looked past Ortiz toward the unit entrance. Administration needs to hear this. Ortiz's mouth tightened. Administration is already hearing it. I got a call from the chief operating officer's assistant asking why I locked a hallway. 10 minutes after the lab got that strange call. Kerr's jaw flexed. Someone is making calls above us. Nora's gaze stayed on Briggs. Then we stopped talking in open air. Ortiz leaned closer, voice dropping. I also pulled the elevator logs. Someone rode up to this floor and back down without scanning into any unit doors. Just a quick trip. Like they came to drop something and leave. Mandy's fingers paused over the keyboard. She swallowed hard. How would they get past the medroom lock? Ortiz looked at her, not accusing but not gentle. They did not. They had access. Kerr turned to Nora. This is not random. Nora's expression did not change. No. A phone rang at the unit desk. Mandy answered. Her voice went formal the way it did when someone with authority was on the line. Yes, this is ICU, she said. She listened, then her face tightened. Yes, I understand. She hung up and looked at Kerr. Hospital administration wants you in the chief medical officer's office. Now. Kerr stared at her. Why? Mandy's voice lowered. They said it is about your Marine patient. Kerr glanced at Nora. Nora did not look up. Her fingers rested on the rail, still and ready. Ortiz muttered, that was fast. Kerr took a breath, then nodded once. I am going, he said, and his eyes stayed on Nora. You are coming with me. Nora's gaze flicked to Briggs, to the monitor, to the drip line she had replaced. He remained stable, sedated, breathing with help. Mandy stepped closer. I can watch him, she said, voice tight. I will not leave the bedside. Nora held Mandy's eyes for one beat, reading her. Then she nodded. If anything changes, you hit the code button and you call me by name. Mandy swallowed and nodded. They left the ICU together. Kerr walked with purpose, but not speed. Ortiz stayed close, scanning the hall. Nora's steps were quiet, measured like she was crossing a room where the floor might give way. The chief medical officer's office sat in a glass box overlooking the ICU corridor. Inside, the lights were brighter than the unit the air warmer, and it smelled faintly of printer toner and expensive hand lotion. A man in a suit stood near the window holding a tablet. Another man sat behind the desk, tie, loosened face drawn. Dr. Alan Mercer, the chief medical officer, looked up as they entered. His smile tried to be professional and failed. Julian Mercer said, "Nora, thank you for coming." Kerr's eyes narrowed. "You called me out of a critical unit." Mercer lifted a hand. "I know. I would not have if I had a choice." Ortiz stayed by the door. She did not sit. She did not relax. The man standing near the window turned. He was tall, hair trimmed, close suit, clean shoes dry despite the weather outside. His eyes were calm and flat, like someone trained to keep feelings behind a wall. He held out an identification wallet. "Agent Cal Vaughn," he said, "Naval Intelligence." The words changed the temperature in the room. Kerr's posture stiffened. Mercer's throat worked as he swallowed. Nora's face stayed calm, but the muscles at her jaw tightened. Fayan's gaze moved to her badge, then to her eyes. "Nora Lane," he said as if tasting it. "That is the name you are using." Kerr stepped forward. "This is a hospital," he said. "If you are here about Captain Briggs, he is under my care." Vaughn did not look at Kerr. His focus stayed on Nora. "Doctor, you are not cleared for this conversation." Ortiz's hand drifted toward her belt radio. Vaughn noticed and did not react. Mercer cleared his throat. "Julian, please." Kerr did not back down. "If there is a criminal act in my unit, I am cleared. Someone contaminated an IV line. That is assault." Valjean's eyes flicked to Kerr at last. Not annoyed, just measured. "We are aware," he said. "That is why we are here." Nora's voice was quiet. "You found us fast." Vaughn's expression did not change. "You lit up a system that does not forget." Kerr looked between them. "What does that mean?" Vaughan slid the tablet onto Mercer's desk and tapped it once. Mercer flinched like the glass was hot. "Captain Mason Briggs," Vaughan said. "Assigned to a unit that does not advertise." He was compromised tonight. The substance in his system matches a chemical signature from an older program, a black program. Kerr's mouth tightened. "Then secure your program." "Do not take my patient." Voss finally met Kerr's eyes fully. "We are taking him," he said. "Military custody, for his safety and for containment." Ortiz's voice cut in sharp. "Containment of what?" Vaughn looked at Ortiz, then back to Nora as if Ortiz was a small obstacle, and Nora was the point. Mercer spoke quickly, trying to keep the room from snapping. "Agent Vaughn, I explained hospital policy. We cannot release a patient without proper transfer procedures." Vaughn nodded once, a gesture that meant nothing. "We have procedures," he said. "They are not your procedures." Kerr's voice rose not loud, but dangerous. "He will not survive transport." Vaughn's eyes stayed steady. "He will survive if we control the environment around him." Kerr took a step closer. "And you think you can do that better than an ICU?" Vaughn's gaze drifted to Nora again. "With her, yes." Kerr turned sharply toward Nora. "Her." Nora did not answer. She stood with her hands clasped loosely in front of her, posture too straight for a tired nurse. The coin pressed against her ribs like a second heartbeat. Vaughn spoke again, voice even. "Commander Catherine Larkin," he said. "Call sign Wraith." The name landed clean without drama, and still it felt like the floor shifted. Mercer's eyes widened. Kerr went still. Ortiz's stare snapped to Nora's face, searching for denial. Nora offered none. Kerr's voice came out rougher than he intended. "Commander." Nora's gaze held Vaughn. "That rank does not exist for me," she said. Vaughn nodded slightly. "On paper, you do not exist at all," he replied. That was the point. Mercer swallowed. "Agent Vaughn." "I was not told this," he said. Voice strained. "She was hired through a standard credentialing process." Vaughn did not look at Mercer. "Your process was allowed," he said. "Until last night." Kerr's eyes did not leave Nora. "You told me Navy," he said. Nora's face remained calm. "I told you enough to keep patients alive." Kerr's jaw tightened. "You let me stand in the dark." Nora's voice stayed quiet. "You asked for a story. I gave you medicine." Vaughn took a small step toward Nora, stopping at a respectful distance, the way someone approached an animal that might bolt. "We have two issues," Vaughan said. "Captain Briggs was targeted, and you were identified. Someone used a compound related to an old operation." Ortiz's eyes narrowed. "Old operation?" Vaughn tapped the tablet again. A file opened, but the screen was angled away from Kerr, away from Mercer. It faced Nora. "Operation Blackcurrant," Vaughn said. Nora's eyes flickered. Just once. It was the only visible crack. Kerr saw it. Vaughn continued. Your unit's records were sealed. Most personnel listed as killed in action. Officially, you were one of them. Mercer's face drained of color. So she has been working here under an alias while listed as dead. Vaughn's tone remained flat. Correct. Kerr looked at Mercer like Mercer might fix it. Mercer looked like a man watching his hospital turn into something he could not control. Ortiz's voice was low. Who is targeting the Marine? Vaughn answered without looking away from Nora. We do not know yet. We know the compound. We know the pattern. And we know this is not the first time the signature has appeared. Nora's fingers flexed once, then still again. Kerr leaned forward. If you have information about a threat inside this hospital, you tell me. Vaughn met his eyes. Doctor, the moment you are told you are involved, you do not want that. Kerr did not blink. It is my unit. Bajin's gaze softened by a fraction, not kindness, more like acknowledgement. Then keep doing your job, he said. Let us do ours. Mercer tried again. Agent Vaughn, she is a hospital employee. She has rights. Vaughn's eyes did not change. Her rights were negotiated in rooms you have never been in. Kerr's voice turned sharp. You do not get to walk into my hospital and take her. Vaughn looked at Kerr for a long beat, then spoke with a careful calm. We are not taking her, he said. We are bringing her into a conversation she has been avoiding for years. Nora's eyes stayed on Vaughn. Why now? Vaughn's answer came quick. Because someone else is still moving, he said. 2 members of your team were never accounted for after Blackcurrant. 2 survivors with no confirmed location. One of them may have had access to the compound. If that person is active, Captain Briggs is a loose end. Kerr's gaze flicked out to Nora. 2 survivors. Nora's mouth tightened. I buried my dead, she said. Vaughn's eyes held steady. You buried someone, he replied. That is not always the same thing. Ortiz's posture stiffened. Kerr stared at Vaughn, then back at Nora as if trying to hear the missing piece in the space between those sentences. Mercer's voice trembled. Captain Briggs is a patient in my hospital, he said. He is not a file. Vaughn nodded once. Agreed, he said. Which is why we will move him with a medical team, and why we need her. Kerr took a slow breath, then spoke to Nora, not to Vaughn. If you go with them, you're handing them control, he said. Nora looked at Kerr. Her eyes were calm, but the fatigue at the corners had deepened. Control is already here, she replied. Kerr's jaw clenched. And Briggs. Nora's gaze softened by a fraction. He will not survive another surprise in our ICU, she said. Ortiz stepped forward. If you take him, I want a written transfer, she said. I want names, badges, and a chain of custody for everything you touch. Bateman looked at Ortiz with something close to respect. You will get it, he said, within the limits of what can be written. Ortiz did not like that, but she held her ground. Then I walk you myself, she said. Vaughn nodded once. Kerr turned toward Mercer. You are letting this happen. Mercer looked older than he had 10 minutes ago. Julian, he said softly. This is not a fight you can win in my office. Kerr's eyes flashed. That is not a reason. Mercer's voice dropped. It is the only reason that matters right now. Nora moved toward the door. I need to check on Briggs, she said. Vaughn stepped aside to let her pass. We will meet you outside the unit, he said. Nora did not answer. She walked out Ortiz at her shoulder, Kerr a half step behind. The ICU corridor felt narrower now, crowded by invisible people. Nurses looked up as Nora passed, then looked away. The beeps behind glass continued steady and indifferent while the building carried a new kind of quiet. At bed 5, Mandy was still at the desk, eyes wide. He is stable, she whispered when Nora approached, as if loud words might invite disaster. Nora nodded. She stepped inside the room and stood over Briggs. His face was pale. His chest rose with the ventilator. The new line ran clear, no shimmer, no film. Nora checked the tape with a careful thumb and smoothed it down. Then she leaned closer close enough that her voice would not travel past the bed. You are not leaving this floor unless you can breathe, she said softly. Not a promise, not a comfort, just a fact she intended to enforce. Briggs did not wake. His monitor kept time. Nora straightened and looked at Kerr through the glass. Kerr stood in the doorway, arms at his sides, eyes hard with questions he could not ask in front of witnesses. Nora stepped out. Vaughn waited in the hallway with 2 other men in plain clothes, their posture too controlled to be hospital staff. Ortiz watched their hands. Kerr watched Nora. Vaughn spoke quietly. We move him when the transport team arrives, he said. Until then, you stay near the patient. Nora nodded once. The coin pressed against her ribs as she breathed in. The beeps continued. The storm outside had thinned, but the bay wind still pushed at the glass, steady as a current. The transport team arrived without sirens. They came through the staff entrance in plain jackets, moving like they knew every camera angle. 2 carried medical bags that looked too new to be hospital issue. Another man walked empty-handed, eyes scanning the ceiling corners and the exit signs. Agent Vaughn met them outside the ICU doors. Ortiz stayed a step behind him, hands near her radio, watching the way their badges hung and how their fingers rested when they stopped. Kerr stood near Nora, close enough to be included, far enough to be ignored. His face held the same hard set it had in Mercer's office, but his eyes kept sliding to Briggs's room. He could hear the beeps through the glass. He could hear the machine doing what it was built to do. Vaughn spoke quietly to the lead medic, a woman with her hair pulled tight and a calm that looked practiced. She glanced through the window at Briggs, then at the ventilator settings on the monitor. She listened to Mandy's report without interrupting, then shook her head once. "He is not moving," she said. "Not tonight." Vaughn's jaw tightened, but he did not argue. He looked at Nora. "They will post a detail here," he said. "No one enters that room without a log and a witness." Ortiz nodded. "That happens starting now?" The lead medic handed Vaughan a small sealed bag. Vaughn did not open it. He passed it to Nora. Nora felt the weight through the plastic. Inside was a compact kit, the kind meant for places without a pharmacy or a second chance. She did not look surprised. She did not ask what it meant. Kerr watched the exchange. "You are giving her a kit like she is leaving," he said. Vaughn kept his voice even. "She is." Kerr's eyes flashed. "She is a nurse in my hospital." Vaughn's gaze met his and held. "She is also the reason your Marine is alive." Nora shifted slightly, just enough to put herself between Kerr and the men in the hall. Her voice stayed low. "Do not make this louder," she said. Kerr's throat moved as he swallowed. "Where are you taking her?" Vaughn answered Nora, not Kerr. "We found a location tied to the compound signature. A facility outside Louisiana. The name on paper is Bayou Helix." Nora felt the coin press against her ribs as she breathed in. The word Louisiana carried its own weather in her mind. Wet heat, dark water, places where sound traveled in strange ways. Vaughn continued, "We have a reason to believe the source is active. We need you to confirm what you saw tonight." Kerr stepped closer. "She is not law enforcement. She is not your asset." Vaughn's expression did not change. "Doctor, you keep using civilian words for a situation that is not civilian." Ortiz lifted her chin. "If she goes, I want it documented. In writing, names, times, where she is going." Vaughn gave her a thin nod. "You will get what can be written." Ortiz did not like that answer, but she accepted it the way you accepted weather. "Then I want her back," she said. Vaughn glanced at Nora. "We move in minutes," he told her. "Change clothes, no badge." Nora looked through the glass at Briggs. Mandy stood by the bed, eyes alert, hands ready. Two men from Vaughn's team took positions near the door, quiet as furniture. The hallway had shifted. It no longer felt like a hospital corridor. It felt like a perimeter. Nora turned to Mandy and stepped into the room. The beeps met her steady and clean. Briggs's chest rose and fell under the ventilator, his face pale, his lashes still. The tape on his new line held firm. The drip ran clear. Mandy's voice was small. "Are they taking him?" "Not tonight," Nora said. Mandy exhaled and looked like she might cry from relief alone. "Then what?" Nora checked the line once more, then the dressing, then the tubing. She made sure there were no loose loops, no easy access points. She did not trust the room simply because it was quiet. "They are posting guards," Nora said. "You chart everything, every entry, every touch." Mandy nodded fast. "I will." Nora leaned closer to Briggs. The ventilator hissed softly. His skin smelled faintly of soap and iodine, but underneath it was the metallic note she could not stop noticing. She spoke low, close to his ear. "Stay where you are," she said. "Do not chase anything." His eyelids did not move. His monitor kept time. Nora stepped back. She removed her gloves and dropped them in the bin, then washed her hands. When she dried them, she felt the familiar steadiness settle again. The same steadiness that had kept her upright in too many rooms like this. Kerr waited outside when she exited. His eyes searched her face with a hunger that had nothing to do with medicine. "You are really going," he said. Nora held his gaze. "They are already here," she replied. "If I refuse, they do it without me." Kerr's jaw tightened. "And I'm supposed to accept that." Nora did not soften her voice. "You are supposed to keep him alive." Kerr stared at her for a long beat. The beeps behind glass filled the silence. Finally, he nodded once, sharp and reluctant. "Fine," he said. "Tell me one thing." Nora waited. Kerr's voice dropped. "That name, Catherine Larkin, is it real?" Nora's eyes flickered. Not denial, not confession. "It is a name," she said. "It was used." Kerr leaned closer, lowering his voice further. "And Wraith." Nora's mouth tightened. "Do not say it in the hall." Kerr's expression shifted, something like understanding, mixed with anger. "All right," he said. "Then listen to me." Nora watched him. Kerr's voice was quiet. "If you step into whatever this is, you do not bring it back to my unit." Nora looked through the glass again at Briggs's bed. "It is already in your unit," she said. "Tonight proved that." Kerr's shoulders dropped a fraction, the closest he came to admitting fear. He reached into his coat pocket, pulled out a folded paper, and held it out. It was a printout from the charting system, a list of Briggs's vitals and meds, the kind of thing doctors carried when they were afraid a screen would go dark at the wrong time. "You will want this," he said. Nora took it and tucked it into the sealed kit bag. Their fingers did not touch. Kerr's eyes held hers anyway. Ortiz appeared at the end of the hall. "They are moving," she said. Nora nodded. She turned and walked toward the staff elevator, not the main one. Vaughn and 2 agents followed. Ortiz stayed at the rear, still acting like a line between worlds. They rode up to the roof in silence. The elevator smelled of metal and faint bleach. Nora listened to the cables hum. It sounded too much like something else, but she kept her face blank. The roof access door opened and wind hit them hard. The air was colder up here, full of salt and rain. Red hazard lights pulsed along the landing pad, turning faces into brief flashes of color and shadow. A helicopter waited with its rotors already turning. The noise filled Nora's bones. The scent of fuel and hot oil rolled over the pad, sharp and familiar. Vaughn leaned in close so she could hear him. "No spoken names in the air," he said. "No calls to anyone. You follow my lead?" Nora nodded once. Ortiz stepped closer to Nora, shouting over the rotors. "You come back," she said, voice blunt. Nora met her eyes. "Watch the med room," she replied. Ortiz's expression tightened, then she nodded, understanding the exchange for what it was. Nora climbed into the helicopter. The cabin was cramped seats facing inward straps hanging like loose vines. She buckled in and put on a headset. Vaughn sat across from her tablet strapped to his knee, the screen dimmed under the cabin light. As they lifted, the roof dropped away. The hospital shrank into a bright block against the black bay. Streetlights blurred beneath sheets of rain. The water beyond looked like a single moving surface, restless and dark. Nora rested her hand against the kit bag at her feet. The coin in her pocket pressed into her ribs with each vibration of the aircraft. She kept her breathing slow. Vaughn's voice came through the headset, calm and flat. "We traced the compound signature through a chain of storage requests and lab inventory anomalies," he said. "Someone is still producing or still testing." Nora looked out the window. The city lights thinned. Darkness took over, broken by occasional flashes of lightning far off. Vaughn continued. "Black Current had 2 unaccounted personnel. The paper says unknown, but paper is a story told for convenience." Nora kept her gaze forward. "If you know the names, say them," she replied. Vaughn paused, then spoke carefully. "One is listed as presumed dead with no body. The other is listed as missing and never closed. The missing one used medical credentials after the operation." Nora's jaw tightened. "Medical," she repeated. Vaughn watched her. "You recognize it." Nora did not answer. The helicopter's cabin light flickered as they passed through heavier rain. The sound of the rotors became a constant pressure, a thick wall of noise that made the world feel far away. After a while, the aircraft descended. A scatter of lights appeared below, low and sparse, not a town, more like an industrial edge swallowed by marsh. The landing pad was set near a road that looked like a thin line across dark water. They touched down. The door slid open. Heat rushed in wet and heavy, carrying the smell of mud and vegetation. Insects buzzed near the floodlights. The air tasted like metal and rot. Nora stepped onto the ground and felt it give slightly under her boots, soft earth beneath a layer of gravel. Vaughn led them to a black SUV waiting nearby. The driver did not speak. He started the engine and the vehicle rolled forward, tires hissing on damp pavement. The road cut through marshland. Dark water spread out on both sides, broken by reeds and low trees. The headlights caught pale eyes in the grass for half a second, then lost them again. Nora watched the water and did not blink. After several miles, fencing appeared. Not chain link. Something heavier. A gate with a keypad and a camera mounted above it. Vaughn entered a code. The gate opened without hesitation. Beyond it stood the facility, low and clean concrete and glass humming with generator power. The lights were on, but the parking lot was empty. The air around it smelled of disinfectant, too sharp for open marsh. They parked near a side entrance. Vaughn got out first and scanned the building. One of the agents carried a small device that glowed faintly. He checked it, then nodded. "One heat source inside," he said. Nora's fingers curled once, then relaxed. She adjusted the strap of her kit bag and followed Vaughn to the door. The entry panel accepted Vaughn's credentials. The door clicked open. Inside, the air was cooler, filtered, and dry. The scent of antiseptic hit hard, layered with something metallic and faintly sweet. The corridor lights were a sterile white. The floor was spotless, reflecting shoes and shadows. Nora's footsteps sounded louder here. The building felt like it was listening. They moved down the hall. A sign on the wall listed departments in clean black letters. Sample processing, cold storage, research suites. The words were ordinary. The quiet behind them was not. At the end of the corridor was a glass door with a keypad. Vaughn entered another code. The lock released with a soft sound. Beyond the glass, the lab lights glowed a colder shade, almost blue. Stainless steel counters held covered trays. A computer monitor slept its screen dark. The hum of a refrigerator unit filled the silence. A figure stood inside with their back turned, shoulders slightly. Hunched hands moving at a bench as if finishing a careful task. A white coat hung from their frame, clean and pressed. Nora stopped just inside the doorway. The air felt thinner. Her hand drifted toward her pocket and found the coin without pulling it out. Fulson stepped in beside her. "Dr. Nathan Cross," he said, voice firm. "Turn around." The figure did not startle. They did not pause. They finished what they were doing, set something down with care, and only then turned. The face was older than Nora's memory wanted to allow. Hair cut short, streaked with gray, eyes steady, familiar in the worst way. He looked at Nora and smiled faintly, like he had been waiting in a room that never changed. "You always had a talent," he said, voice calm, "for finding your way back to me, Wraith." Cross's smile barely moved his cheeks. It sat on his face like a practiced expression, something he could put on and take off without leaving a mark. Nora did not answer him. She stood just inside the glass door, boots planted on spotless floor, kit bag strap, firm in her hand. The air was too clean, filtered, dry. Under it, a faint sweetness clung to the back of her throat, the kind that did not belong in a hospital. Agent Vaughn lifted his identification wallet again, as if the leather and gold seal could pin reality in place. "Dr. Nathan Cross," Vaughn said, "you are in possession of restricted biological material and operating outside authorized containment. You are coming with us." Cross's eyes slid from Vaughn to the two agents behind him, then back to Nora. He did not look afraid. He looked curious, like he was watching a familiar experiment repeat. "Coming with you," Cross said, voice mild. "To where?" "Another windowless room, another committee that pretends it understands what it asked us to do." Vaughn kept his tone even. "Turn around, hands behind your back." Cross took a slow breath and finally looked away from Nora, but only enough to glance at the stainless counter beside him. A tray lay there, beneath a clear lid. Condensation clung to the plastic. The faint hum of a refrigerated unit filled the space between heartbeats. "You brought her," Cross said to Vaughn, still calm. "That tells me you are already behind." One of the agents shifted hand near his sidearm, but he did not draw. The room did not need a gun to feel dangerous. It was dangerous because it was quiet. Nora spoke for the first time, her voice soft and controlled. "Why are you here?" Cross's gaze returned to her at once. "You do not ask that," he said. "You know why. You have always known. You just decided you could walk away from it." "I walked away from you," Nora replied. Cross gave a small nod, almost like approval. "You tried," he said. "I will give you that." Vaughn stepped forward. "Enough," he said. "You will answer questions in custody." Cross smiled again, smaller this time. "Custody," he repeated. "You mean silence?" Nora's fingers tightened on the kit strap. In her pocket, the coin pressed into her ribs with the vibration of the building's generators. The sound of the ventilator from the ICU was not here, but her mind filled in its hush anyway. Beep! 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 The rhythm that said someone was still holding on. "Captain Briggs was poisoned," Nora said. "In a locked unit, in a hospital. That took planning. That took access. Did you do it?" Cross's eyes held hers, steady and almost gentle. "You still say his name like he is a person," he said. "Not a loose thread." "He is a patient," Nora said. Cross's mouth tightened at the word, like it bothered him. "He is a witness," he replied. "He remembers things the world decided to bury. That is why he was touched." Vaughn's posture changed sharper. "So you admit involvement?" Cross glanced at Vaughn as if he had forgotten he was there. "I admit the math," he said. "I admit cause and effect. Involvement is a word for people who still think the board is fair." Vaughn moved again. "Turn around." The second agent stepped closer, cuffs ready. Cross did not resist. He simply lifted both hands, palms out, and took a half step back from the bench toward the wall panel behind him. Nora's eyes tracked the movement without thinking. His feet were too careful. The step was not random. Cross's voice stayed calm. "Do you ever think about what it could have been," he asked Nora, "if they had not panicked, if they had not ordered the burn?" Nora's eyes narrowed. "People died." Cross's gaze did not flinch. "People always die," he said. "The question is what you get for the death." Nora's jaw tightened. "That is not a question." "It is the only question," Cross replied. Vaughn snapped, "Cuff him." The agent reached for Cross's wrist. Cross's heel pressed down. A soft click sounded beneath the hum of the refrigerators. It was small, almost polite. A hidden switch. A floor pedal disguised by shadow. For a beat, nothing happened. Then the lab lights shifted. White to red. The emergency strobes began to pulse, painting the stainless surfaces in a slow, bleeding rhythm. A siren rose, not loud at first, but deep like something waking up. A flat voice came from a ceiling speaker. Containment protocol engaged. The glass door behind Nora locked with a heavy clunk. The other agent spun and grabbed the handle. It did not move. Door is locked, he barked. Cross exhaled, almost satisfied. There it is, he said softly. Vaughn's eyes cut to him. You triggered a lockdown. I triggered safety, Cross replied. You walked into a controlled environment and brought contamination with you. The system is doing what it was built to do. A vent overhead hissed. Not air conditioning, something pressurized. A thin mist began to seep from the seams near the ceiling. It fell in lazy ribbons, at first catching the red light, turning it into a soft, floating haze. Nora's nostrils flared. The faint sweetness grew stronger, then shifted into metal like a battery touched to the tongue. Her stomach tightened. One agent raised a handheld sensor. Its screen glowed and then flashed a warning color. Airborne particulate rising, he said. Unknown compound. Vauban's voice stayed controlled, but his eyes had sharpened. Cross, he said. Stop it. Cross looked at Nora again. It is not poison, he said. Not in the way you mean. It is targeted. It is precise. It does what we tell it to do if we respect the dosage. Nora's voice stayed low. People convulse when you respect the dosage. Cross's expression flickered a hint of irritation. Because you saw the crude version, he said. The field batch. The rushed batch. You saw it in a war zone because they forced it into a war frame. It was never meant for that. He gestured toward the covered trays, toward the sealed containers lined up in a chilled cabinet. Labels, codes, neat handwriting. They wanted a weapon, Cross said. A deterrent, a tool. I wanted a treatment. Controlled properly, it could starve malignant cells. It could turn a death sentence into a manageable disease. We were close. Nora stared at him. Close enough to kill a Marine in my ICU? Cross's eyes did not lower. Close enough that someone will keep trying, he said. Vauban snapped to the agent at the door. Override. The agent slapped the keypad, entered a code. The panel flashed red and beeped once, then stayed locked. No access, the agent said. It is rejecting credentials. Cross's smile returned faint. This wing does not answer to you, he said. The mist thickened. It curled around the overhead lights and drifted down soft as fog off the bay. It slid into the agent's hair and clung to fabric. It made the air feel heavier with each breath. Nora pulled the sealed kit closer with her foot and dropped to one knee. She opened it with quick fingers. Inside were compact supplies, filters, sealed syringes, a small respirator mask folded tight, the kind of equipment meant for places where you worked in silence and left no receipts. She did not comment on it. She simply moved. Mask up, she said. Vaughn looked at the kit, then at her. You brought that. No, Nora said. You did. She snapped a filter onto the respirator and handed it to Priya's absence, a habit, an instinct to pass gear to someone who should be there. Her hand paused in the air, then she handed it to the nearest agent instead. The agent took it eyes wide. He strapped it on. Vaughn put on a mask, next movements practiced, but not fluid. He was trained, but he was not her kind of trained. Cross watched them like a lecturer watching students struggle with a simple concept. You see, he said. You came in loud. Now you are learning quiet. Nora stood and moved to the central control console near the far wall. It was built into the counter, protected by a locked panel. A monitor above it displayed containment status, airflow routes, pressure readings, warnings, stacked in bright block. The screen flashed a line of text. Manual intervention required. Nora's eyes tracked the map of vents like it was anatomy. She saw pathways, branches, where the air would go, how quickly. Vaughn stepped in behind her. Can you shut it down? Nora did not look at him. If the system lets me in, she said. She tried the panel latch. Locked. She tried the keypad beneath it. It flashed the same rejection color. Cross's voice drifted through the red light. You cannot stop it with hospital hands, he said. Only mine. Vaughn turned toward him, anger finally breaking through. Open it. Cross lifted his chin. I will not, he said, because you will take it and burn it. You always do that. You panic, you erase, you call it security. The mist thickened again. Nora felt it crawl into her sleeves. It was cold against her skin. She kept her breathing shallow behind the mask. She looked at the panel again, then at the screws along its edge. She slid a tool from the kit, a compact driver, and began to loosen them. The agent at the door barked, We need to leave, now. Vaughn's head snapped. If we leave it vents into the marsh, he said. It spreads. Cross's eyes gleamed faintly in the red light. It will not spread far, he said. It is designed to decay, but it will make a point. Nora kept working the screws. Her hands were steady, her shoulders stayed level. The metal driver turned with soft clicks, each one precise. Vaughn watched her. If you can open it, he said, can you neutralize? Nora did not answer immediately. She pulled the panel loose and set it aside. Inside was a tight web of wiring valves and a manual lever mechanism with a safety latch. She stared at it, then reached in, testing the latch with her glove. Cross spoke again, voice almost conversational. "You always were the one who did the ugly work," he said, "while the rest of us wrote reports." Nora finally looked at him. Her eyes were hard now, not angry, but stripped of softness. "You wrote reports," she said. "I held people together." Cross's smile faded. "And you made choices," he replied. "You decided who got the last med, who got the last seat, who got the last breath. Do not pretend you are innocent of the math." Nora's voice dropped. "I never pretended." The mist swirled lower, touching the floor in thin streams. It slid around their boots like water. Undertow in the wrong shape. An alarm tone changed pitch. The monitor above the console flashed a new warning. "Secondary release imminent." Vaughn moved closer to Nora. "Do it," he said. "Whatever you have to do." Nora's gloved hand closed around the manual lever. The metal was cold. It resisted slightly, like it did not want to move without permission. She pulled once, testing. The latch held. She adjusted her stance and pulled again harder. The latch shifted a fraction, and the lever gave a small, reluctant movement. Somewhere in the ceiling, vents, the hiss deepened, and the red strobes pulsed across Nora's face as she kept her grip and set her weight, ready to force the system to obey. Nora set her feet and pulled the lever with her whole weight. Metal protested, then yielded in a slow, stubborn slide. The latch gave with a sharp snap that sounded too loud in the sealed room. The console monitor flickered, recalculated, and the warning blocks reshuffled like cards in a nervous hand. The hiss in the vents changed tone. It deepened, then thinned, as if the building had drawn a long breath and decided to let it go. A new line of text appeared on the screen. Manual purge engaged. Vaughn leaned closer, eyes fixed on the airflow map. Where does it vent? Nora kept one hand on the lever. Her other hand moved over the wiring, tracing the diagram with a gloved fingertip. "It is not venting outside," she said. "It is cycling through a neutral chamber." Cross let out a quiet laugh. "You think a lever makes you in control." Nora did not look at him. She reached into the kit, pulled out a small sealed canister, and cracked the cap. The scent that came out was sharp and clean like a pool deck at night. She fitted it into a port on the open panel, then locked it down with a twist. The console beeped once, not an alarm, a confirmation. The mist in the air did not vanish. It paused as if deciding which way to flow. Then it began to move in thin, steady streams toward the ceiling returns. The red strobes made it look like smoke being pulled into a mouth. One of the agents coughed behind his mask. "Is it working?" Nora watched the particulate reading drop a single increment, then another. Slow, patient, like tidewater drawing back from shore. "Yes," she said. "Keep your masks on." Cross's eyes narrowed, irritation breaking through his calm. "You always were good at damage control." Nora finally turned to face him. The red light sharpened the angles of his face. The years had not softened him. They had only made him cleaner. "Damage," she said, voice low, "is what you call people." Cross lifted his chin. "People are the cost," he replied. "You know that better than anyone in this room." Nora did not raise her voice. She did not need to. "I know what it feels like to hold that cost in your hands," she said. "You only ever held the idea of it." Vaughn stepped between them, cuffs ready. "Enough," he said. "Hands behind your back." Cross looked at Vaughn as if he were a clerk interrupting a lecture. "If you take me," he said, "you take the only person who understands the compound." Vaughn's voice stayed flat. "We have scientists." Cross's gaze slid to Nora again. "You have her," he said. Nora returned her attention to the console. The levels kept dropping. The mist thinned from haze to threads. The sweetness in the air weakened, replaced by the harsh, clean scent of the neutral agent. Another line appeared on the monitor. "Secondary release canceled." The siren pitch changed again, dropping to a lower tone. The red strobes slowed. The room felt less like a trap and more like a place with walls. The agent at the locked door tried the handle again. It still did not move. Nora reached into the exposed panel and flipped a smaller switch. One Cross had hidden behind a bundle of cables. The console flashed. Lockdown disengaging. A second later, the door released with a heavy click. The agent pulled it open and air rushed in from the corridor. Cooler, fresher. It tasted like nothing, and nothing had never felt so good. Vaughn nodded once. "Move out," he said. Nora kept her hand on the lever until the particulate reading hit green. Then she released it slowly, like letting go of a railing after rough water. Her glove squeaked against metal. For the first time, she noticed her own breathing. The mask felt tight. Heat prickled under her collar. She pulled the respirator off and drew one careful breath of the filtered room air. Her throat stung. A cough tried to rise. She swallowed it down and forced her face to stay steady. Cross watched her eyes sharp. "Still saving everyone," he said softly, "even the ones who do not deserve it." Nora did not answer. She stepped away from the console and stood beside Vaughn. Vion signaled the agent with the cuffs. Now! Cross did not fight. He offered his wrists with a calm that felt like a final insult. The cuffs clicked closed. The sound was small and final. As they led him toward the door, Cross turned his head just enough to look at Nora again. His voice dropped quiet and sure. They will bury this, he said. They always do. Nora met his gaze without blinking. Then you will sit with it, she replied. They moved him out into the corridor. The facility felt less silent now. The alarms were fading. The generators still hummed. The overhead lights returned to their sterile white. Outside the lab, Vaughn spoke into his radio voice clipped. Containment stabilized. Secure all samples. Bag every vial. Photograph everything. No one touches a surface without gloves and logs. One agent approached Nora holding a sealed evidence bag. Inside was a small glass vial, clear liquid catching the light. He held it up for her to see. Is this it? He asked. Nora looked at the vial. It is part of it, she said. Treat it like it wants out. Vaughn watched her for a beat, then nodded toward the exit. We are done here, he said. We go back. The SUV ride was quiet. The marsh stretched on both sides, black water reflecting the headlights in broken lines. Nora watched the reeds bend in the wet wind. When she closed her eyes for a moment, she could still see the red strobes and the drifting mist. She opened them again and focused on the road. Back at the landing pad, the helicopter rotors were already turning. Vaughn climbed in first. Nora followed kit bag in her lap, hands resting on it as if it might shift on its own. As they lifted into the humid dark, Nora felt the change in air pressure in her ears and the familiar vibration in her bones. She rested her head back and kept her eyes open. The coastlights appeared again, scattered and distant. Then the bay, then the city, then the bright block of the hospital by the water. On the roof, Ortiz stood under the pulsing red hazard lights with 2 guards at her sides. Her stance was rigid, chin-up eyes locked on the descending aircraft like she was refusing to blink first. When Nora stepped onto the pad, Ortiz grabbed her elbow, quick and firm, then released just as fast. You look like hell, Ortiz said. Nora's mouth tightened almost a smile. You should see the other guy, she replied. Ortiz's eyes flicked to Vaughn, then back. Your marine is stable, she said. Kerr has not left the unit. Nora nodded once and headed for the door. The sound of the rotors faded behind her as the roof access door sealed shut. In the elevator down the hum returned softer than the helicopter, but no less familiar. Nora stared at the floor numbers and let her breathing slow. The ICU corridor looked the same as before. Dim light, glass walls, soft beeps. But the perimeter was real now. 2 men in plain clothes stood near bed 5, eyes scanning the hall. Ortiz's officers were posted at the unit entrance. Mandy's charting station was stacked with logs, neat handwriting covering pages. Kerr stepped out of Briggs's room the moment Nora appeared. His eyes swept her face, her hands the kit bag. You are here, he said. Nora nodded. He is alive. Kerr's jaw flexed. He is stable, he replied. He tried to wake again. Nora moved past him into the room. Briggs lay under the blanket ventilator, still assisting, but his color was better. The gray had retreated. His eyelashes fluttered, as if he were fighting back through deep water. Mandy stood at the side rail, eyes tired but steady. No one touched his lines without me, she said. Not once. Nora met her eyes. Good, she replied. Kerr's voice was quieter now. Administration wants statements, he said. Mercer wants to know what he should say to the board. Nora checked the line, then the dressing, then the pump. Clear, no shimmer, no film. She let her shoulders drop a fraction. Tell them the truth you can tell, she said. Kerr watched her hands. And the truth we cannot. Nora looked up at him. That stays where it belongs, she replied. Briggs's eyes opened a little. His gaze drifted unfocused, then found Nora. Recognition sparked for half a second, then softened. His lips moved around the tube. Nora leaned closer. Do not waste your breath, she said softly. Save it. His fingers shifted under the blanket, slow and weak. He made a small motion with his hand, 2 fingers lifting in a gesture that was not quite a salute, but wanted to be. Nora placed her palm lightly on the back of his hand, steadying it. The beep continued even and calm. She straightened and stepped back, letting Mandy take the bedside again. Kerr followed Nora out into the corridor. Ortiz watched from the entrance, arms folded, eyes still hard. Vaughn waited near the unit desk, tablet in hand. Cross was not with him. 2 other agents stood nearby, posture tight, eyes forward. Vaughn's gaze met Nora's. You prevented a spill, he said. Nora did not respond. Praise had no place here. Vaughn continued. Your status remains complicated, he said. But your name is no longer invisible to our systems. Nora held his gaze. I know, she said. Valson nodded once, then looked at Kerr. Doctor, he said your patient stays here under protection. He does not move until medically cleared. We will provide personnel. Kerr's shoulders loosened just a fraction. That is what I told you, he said. Vaughn glanced back at Nora. You do not leave this building without notice, he said. Nora's voice stayed even. Then keep your notice out of my unit, she replied. Vaughn's mouth tightened. It was the closest he came to a smile. Understood, he said. The shift finally ended. The storm had passed. Dawn light washed the bay in a thin gray sheet. Nora walked out of the hospital into air that smelled like wet pavement and salt. The parking lot was littered with small branches and wind-blown trash. The flag on the pole near the entrance snapped once in the breeze, then settled. Time moved in quiet steps after that. The hospital repaired what the surge had strained. The staff returned to routines that never felt fully routine again. The security logs stayed thicker. The medroom locks stayed tighter. A new plaque appeared in the lobby corridor near the trauma entrance. Brass clean mounted on freshly painted wall. The letters read the Lane Protocol with a line beneath it, honoring staff lost in service and patients saved in crisis. The words were simple. The metal was bright under overhead lights. Kerr stood beside the plaque in a clean coat, coffee in hand, eyes tired in a way sleep could not fix. Ortiz leaned against the wall nearby, watching the foot traffic like she was still on perimeter. Mandy passed with a chart, nodded once, and kept moving. Nora approached quietly. Her scrubs were clean. Her badge was clipped straight. Her hair was tucked under her cap. She looked ordinary again, if you did not watch long enough. She reached into her pocket and took out the coin. Silver, worn, scratched. She turned it once between her fingers, felt its ridges, then pressed it against the plaque's base ledge and let it sit there. Kerr watched her hand, then her face. You are staying, he said. Nora kept her eyes on the coin for a beat. I work here, she replied. From the corridor behind them, a wheelchair rolled past. Briggs sat in it, thinner now, a blanket over his legs, his hands resting on the armrests. A corpsman pushed him slowly. Briggs lifted his chin when he saw Nora. His eyes held hers for a second, steady and clear. He raised 2 fingers to his brow. This time the salute was unmistakable. Nora did not return it with her hand. She returned it by holding his gaze without flinching. The beep from a nearby monitor echoed down the hall, steady and calm, like a tide that had found its rhythm again. Briggs rolled on wheels, soft against tile. The hospital doors opened and closed with their familiar hush. Outside the bay, wind moved across the water, not violent now, just persistent, the way it always was. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.